all the textbook stuff, but a lot of the stuff you can't learn in the textbooks. You can't learn in the traditional medical schools. Dr. Hal Blatman, he runs the Wellness Center in Cincinnati and here in New York, the Blatman Health and Wellness Center. Doctor, welcome. How are you?
Thank you very much, Greg. It's wonderful to be here.
And one of the big things that you told me, I'm aching all over the place at the time, diet. I never had any idea that diet really can have an impact on one's bodily pain.
I would say that food and inflammatory food in the average chronic pain patient is at least 50% of the pain you walk around with.
50%. And what are the basic, and it's not like this crazy diet we have to go on. There are just certain things we should do and avoid. What are they?
Gluten, dairy from cow, and sugar are the three big ones. And the things that turn into sugar can make you really uncomfortable, like white potatoes.
White potatoes, dairy from cow. We want to avoid that. Gluten. So, all right. What does that list look like what does that translate into food?
It translates to you avoid a lot of those grains. And what people don't understand is the absolute nature of where this goes, because the tiniest amount of gluten contamination can make your back hurt for 4 weeks.
Oh my goodness. Doctor, I think you have this all figured out. So Dr. Hal Blatman, my special guest, stay with us, folks. This could change your life. You went to medical school, and what kind of doctor were you planning to be?
I wasn't really sure, but I started in orthopedic surgery.
Orthopedic surgery, bone surgery.
Bones and joints, breaking bones, making them straight, replacing joints, repairing tendons, rotator cuff tendons, doing sports medicine at the highest level. That's where we were at the University of Cincinnati, and putting fingers back on when people got them cut off.
Wow. All right. All that's great work. We needed to be done, right? But you had would you call it an epiphany? Did you have I want to go in this direction? Was there a moment, or was there something that kind of put you on a new path?
It was orthopedic clinic, and people would come in and they'd have their pains and their joint pains. And back in those days, we were taught, don't prescribe Percocet, prescribe Motrin. And there was a 400 milligram Motrin. We prescribed that. People would come back to clinic and say it didn't work. Fortunately, there was a 600 milligram Motrin just came out, so we used that. And that didn't work any better. And I started to realize that pain is not what we were taught. And what we were taught isn't working to get people out of pain, so there's got to be another answer.
Percocet. Boy, that stuff is powerful stuff.
Yes, it is.
And and that stuff in a weird way works, but it gets people hooked, right?
It sure can.
Okay, so pain was not being managed. So how did you figure out this kind of new way to manage it?
Well, I hurt my back on the Nautilus low back machine back in the early 1980s. And I got this journal article from a doctor telling us how we could do a physical exam to prove that the patient was faking. Because in those days, you couldn't tell whether somebody was faking and just trying to get their Percocet or not. So you had to determine that. And I realized I'm 4 days out of my injury. I didn't have my first pain-free moment yet, and I couldn't pass this guy's test. And I realized that the person who wrote this article didn't know the first thing about pain. He never had pain in his life. And whatever he wrote in his article was totally irrelevant and didn't work.
But that was like almost industry standard.
Correct.
Wow. All right. You had genuine pain, and you wouldn't qualify to get the pain relief. Incredible. So, all right.
And then through the years, I started to learn about food, and the more I changed my food, the better my pain got. And I got to tell you, I played golf with lower back pain in every swing for 25 years. So I figured how to make it go away. And to do that, I had to unkink the fascia strings that got tied up from the injuries of a lifetime, and I had to repair the injuries to the tendons that hold my gluteal muscles together. And as I got that done and fixed my food, I was able to make almost all my back pain go away. And then I found out it's universal. It's all of us. It's rarely the disc, rarely the nerve. It's injuries of a lifetime that cause this pain.
You happen to be very slim, by the way, and you wake up in the morning and you're pain-free?
Not pain-free, but by the time I've done my morning routine and exercises, I'm pretty pain-free. And compared to the pain I used to have, I play golf with no pain on any swing.
What do you mean about lifetime injuries?
Well, if you can touch a muscle in your neck, in the front of your neck, and you can feel it's tender. You can push on the space above your collarbone, and you can feel that's tender. Collarbone tenderness is the injury that causes the tenderness in the muscle in the front of your neck. And the first time you got that injury, you were an infant and somebody picked you up by your shoulders and forgot to bring your head. That, and another time you had that injury, you were in the playground and some little kid came up behind you, shoved you forward, snapped your head back, and made that injury that now is leading to headaches and a pain we call trigeminal neuralgia, or possibly the rest of your life. Because nobody's figured out that your headache doesn't come from your head, your blood vessels, or your nerves. Your headache comes from the fascia injuries of a lifetime to your neck and shoulders and upper back.
Man, so that's a revolutionary way to look at it. And we can't avoid that childhood stuff, right? It's just going to happen.
And we jumped out of trees, and we jumped out of swing sets, and 30% of us, my estimate at least, jumped off at least the first story of the roof. And when we land, we tear those tissues, and as we get older, they become less resilient. And now we lift a bag of mulch. We feel something shift, and we got pain down our leg that we think is coming from the disc in our lower back.
So this is not for me selfishly. I have a 2-year-old and a 4-year-old. Look, they should still go out and play and do that stuff, right? I mean,
absolutely.
They're not going to be there. They should still jump and have fun.
Yes.
All right. But once they get older, this is the way to manage it. Doctor, when a patient comes in, how do you handle it? By the way, you got a great bedside manner. You know what I mean?
Thank you.
The gentle, I feel like I could tell you anything. A patient comes in suffering from, who do you want to see? Who should see you?
I want to see anybody who's really sick and tired of being sick and tired. And in our first visit for a chronic pain patient, our first goal is to help show you in your first visit the injuries through your lifetime that cause the pain, help you understand what your body needs to do to make that pain go away, and then get you started doing it so some of your pain is gone before you walk out of the office on the first day and you know this is going to work.
I don't know you press a couple of buttons. It feels like you're pressing buttons, right? And you're in there and it does kind of work itself out. What kind of follow-up? How does it work? What is the Dr. Blatman experience like after the initial checkout?
We send you home learning how to change your food. We send you home learning how to do your own body work so that you can make your own pain go away, whether it's in your knee or your neck or your shoulders or even your lower back. And then as you come in, we do body work to help unkink the injuries of a lifetime and then restore your tendons and make them whole again so that when you pull, you anchor and you hold together instead of tearing yourself apart from the inside.
All right. I think this is incredible. 844-282-8900, 844-282-8900. If you want to see Dr. Blatman, and he's very accessible. You're right in Midtown. What's your address?
120 East 56 on the 12th floor between Park and Lexington.
That's where I go to see my dentist, actually. That's a very convenient location right off of Park Avenue. By the way, you see people in New York, and you also have a thriving practice in, of all places, Cincinnati.
Cincinnati, Ohio, that's correct.
You're back and forth. Cincinnati, are the New York patients different from the Cincinnati patients?
Totally different culture and a lot of fun.
I was hoping I don't know what I was going to, I thought you would say, people are people. How are we different?
People are people. The injuries are the same. The pain is the same, but the culture is very different.
Are we more vocal about our pain here?
You want to get it done.
Yeah.
You don't have time to waste. You don't have time to be in pain. You want to get it gone and go back to work and back to your life. And you don't have time for this.
I think that's code for we're a little pushy. That's okay. No, we're not pushy. We're just, time is money here in New York. Well, all right. Let's see here. We want to go to the Blatman healthandwellness.com. So that's Blatman healthandwellness.com. And you can also call that number 844-282-8900. You go in, you kind of people learn exponentially what about their body. That stuff about childhood, that's incredible. And then the diet thing is really, it's not that hard either. I mean, it's not that hard to avoid yogurt. Let's face it, right?
Correct.
And if you
that hard, and when you realize that a little bit's going to make your neck and shoulders hurt for 4 weeks, that's a big deal.
Uh-huh.
And then there's people who come in with joints, and they want their joints to get better because their knees hurt. And you read all over that you can't regrow cartilage in a worn-out joint, and that is so not true.
You can't regrow cartilage in a worn-out joint.
Even the orthopedic textbooks say that when you're born with cartilage and you wear it out with time and then you go get your joint replaced, that's utter nonsense.
Overall, they talk about the healthcare industry, and sometimes I've heard that they kind of want people sick. They want people reliant on them. They want, I'm not talking doctors, maybe it's big pharma. I don't know. We don't have a wellness system. We have a sickness system. Do you have any thoughts on that?
All that's true. We all hear those words all the time. And what we focus on is how do you restore this biology to health?
How do you restore this biology to health? Well, see you, and you'll learn a lot. 844-282-8900, and it's Blatman, Blatman, healthandwellness.com. Can I just ask you this? You chose to be a doctor. A lot of things people can choose to do. Why did you choose that?
I really wanted to help people. I wanted to be able to use my imagination. I wanted to make sure that through my lifetime, I would be figuring things out and I would never be bored.
Doctors are never bored.
I'm fascinated by what I do every day. I learn something new every day, and I'm able to apply it to help people every day. And I watch people get out of pain, and I watch people get out of misery, and that is so rewarding. I couldn't be in a better place.
Wow. Well, doctor, I'm sold. And folks, he's the real deal. And Blatman Health and Wellness, Blatman. What kind of name is that, by the way? Is it what were your ancestors?
I think they partly Poland, partly Ukraine is the best we can figure.
And but now American. Bottom line,
third generation.
Third generation. First doctor in the family.
Actually, I'm second generation. Yeah, first doctor in the family.
Well, congratulations, and thank you for what you're doing. And folks, go check it out. It's really interesting, and a pain-free life is available. No pills, and a couple of modest changes. And 844-282-8900, Blatman Health and Wellness. Doctor, thank you very much. Great to talk to you.
Thank you, Greg. Wonderful to see you again.
And to be continued, we'll be right back.
This is The Healthy Healer, where true voice is your medicine. This is where we help doctors and other healers navigate through the challenging times by learning from the best minds in the healing industry. Laugh, cry, and be surprised. It's entertainment, education, and inspiration so you can continue to be the unique and amazing healer you were destined to be. Welcome to humanity. Welcome to The Healthy Healer with Dr. Fred.
Hello, everybody. It's Dr. Fred, and welcome to another amazing episode of The Healthy Healer. And today, I really do have a massive honor. I know I say that every week, but today it really is a massive honor because the man that I'm accompanying with tonight, the man that I'm interviewing and introducing you to, is somebody who I've known for several years this time. Now, we took a few years off. We weren't talking all that much. We knew a little bit about what each other was doing. He's a friend of mine from Cincinnati. He knows everybody I knew in Cincinnati, and I knew everybody he knew in Cincinnati. We spent holidays and trips together. We took a bunch of bike rides together. We did a lot of golfing together. We had a lot of Shabbat dinners together. We've done a whole lot of things together over time. Probably been together. Oh, even I remember the first time that we met, even. Maybe we could talk a little bit about that. But it had a little bit to do with Jimmy Page and Robert Plant, as I recall.
Oh, my God.
That's it.
That is
Exactly
one of my
how we met.
fondest, that one and the camping trip with the kids are two
Yeah.
of my fondest memories.
Yeah.
I've
it
never
really
done
amazing.
that in my life. Gotten on
That
a
was-
plane and gone to a concert.
That was really. Oh, that was the Who. We did the Who, actually. We did Quadrophenia in Madison Square Gardens as well.
Yeah.
So this is a rock star, a true rock star, and a friend of mine, an amazing physician, an amazing healer. And without further ado, I want to introduce you all to Hal Blatman. Hal, thank you so
Hello.
much for being on The Healthy Healer.
Fred, I'm so glad to be here and so glad we reconnected.
Thank you. Yeah, it's really beautiful. So, yeah, some of the things that we did early on to meet, I think we actually met in Cincinnati when I think Dave gave us tickets for that, for Plant and Page together. And then realizing that we were doctors who were rock stars at the same time, we set up to go to Madison Square Gardens and saw Quadrophenia perform live by The Who, which is absolutely ridiculous.
From the back row.
From the back row. Really unbelievable show. Super fun. So, Hal, what are you up to these days? Some of the things I like to ask my guests, I have a particular question that I like to ask a lot of guests, but for you, it doesn't really fit. So it's a 9-letter question. It's a profound question that is grammatically correct and only has 9 letters in it. And so the question is, and in this case, it would be 12 letters. Hal, who are you?
Wow, that's pretty cool to have just those letters. It's an interesting way to reflect. we've both been around quite a while, and whoever I've turned out to be, I really like him.
That's
Um,
beautiful.
I'm proud of him. I think he's done well by people, and I think he's got a lot of work left to do. Speaking in third person about myself, turning outside and looking in or looking at, and I'm glad I like what I see. I am all about helping people get out of pain and see the truth, and in the process, hopefully, be able to change medicine and keep so many people from suffering that they don't need to suffer.
That's unbelievable, beautiful, and that is how I know you. Talk to me about this idea of seeing the truth, Dr. Butt.
There's so much of what we have seen that doesn't turn out to be true. There's so much of what we've learned that what we've learned isn't the way our world works or the way our body works. And I've gotten to see medicine from that side. And so much of medicine is not what we were taught. You've learned so much of psychiatry is not what we were taught. And I've learned that nothing can be more true than with pain. Pain is so much not what we were taught. And it's not that what we were taught is wrong. It's that most of what we were taught is not even relevant to what causes pain or what it takes to really make it go away. We've taken a sidebar, and sure, the things we've learned are real. A knee is a knee, kneecap is a kneecap. All things move the way they move, but pain doesn't come from disc and spine and nerve or even inflammation as we were taught. And as you go to a doctor to talk about your pain, sooner or later, hopefully, if you have pain long enough and you go from professional to professional, provider to provider, at some point you start to realize that none of the people you've seen really know what they're talking about.
Oh,
And you go on with pain, you take medicine, and then my colleagues, those in pain medicine, they do things that maim people in the
hmm
fake of medicine. We kill nerves, we kill muscle, we call it radio ablation. We put massive doses of steroids in people's spines, and these are poor, desperate people who hurt. We offer them surgery with a 50% chance of success. And they're desperate enough to do it because nothing else they've done has worked. And some of what they do helps for a short time, some helps a little for a long time, but none of it really makes it go away,
hmm
partly because none of it really addresses the problem that causes the pain or sees the injuries. I have a patient who's a above the knee amputee. We're all taught that phantom limb pain is central, comes from your head. It has nothing to do with your head. Phantom limb pain has to do with the residual limb and the fascia that's retained that was traumatized during the event that still sends pain to the foot. Doesn't care there's no foot there. And all you've got to do is help the fascia repair, and that pain goes away. It's amazing how quickly pain can go away and how everybody can do it with their hands and how people can see it and it can be figured out. And it's not easy and simple, but it's fairly straightforward to understand. So
hmm
I've defined pain into 5 rules that seem to stand the test of time, that help elucidate where it all comes from, and none of it is what we were taught.
Let's hear him, of course. We can't bated breath.
So rule number 1, you can't believe the pain comes from where you feel it. Your headache doesn't come from your head, and contrary to what we're taught, not your blood vessels and not your nerves. And don't they tell us the pain in our left arm could be a heart attack?
They
And
do.
talk to your friends who've had their knee replaced, and how many does the knee still hurt? And the pain never did come and still doesn't come from the joint. Interesting thought, right? Rule
Fantastic.
number 2, it's not important what we think pain feels like. Our brain can't tell the difference between numbness, tingling, burning, itch, tickle, sharp, dull, achy, stabbing, and interestingly enough, to some extent, not even sexual arousal. Can we talk about that?
Of course.
So if Mike Tyson bites your ear off, everybody knows that's going to hurt, right?
Mhm.
Your
Yeah.
honey touches your ear. You have a much different reaction through your entire biology. And then you find out it doesn't even have to be your ear. Same skin, same nerves, goes the same part of your brain as the pain.
Mhm.
Rule number 3. At the end of the day, the only thing you can really believe is what you can touch and feel. It's really hard to beat that, right?
Yeah.
But the most important part of your exam is where specifically are you tender, millimeter by millimeter? Because the only places in your body that are tender, unless you beat on something and make a bruise, the only places that are tender are where the strings of fascia that go through you and hold you together are kinked and tied in a knot that many of us have called a trigger point, or where they weave and anchor and hold you together, and you've injured and repaired them hundreds of times. That's the only places you're tender when you push. Rule number 4, if I examine you that way, from head to toe, the places where your body is overall most tender represent those kinks and injuries through your lifetime that generate most of the pain of which you are conscious. And rule number 5, better than 90% of the time, no matter how long you've had the pain, and no matter what you think is your diagnosis, as quickly as you unkink those strings at where you need to, strengthen how you anchor and hold together so the next time you pull, you stay together. As soon as you do that, the pain that you had is already gone, no matter how long you've had it, no matter what's your diagnosis, almost all the time. And those 5 rules have nothing to do with your spine, your disc, your nerve, whether something's out of balance, whether it's in balance, whether you're compensating for this or compensating for that. And God knows all the other things that we've heard that all have some element of truth, but at the end of the day, compared to what's really going on, they all belong in the horse poop drawer
Mhm.
because 80% of the information that comes to our brain from our periphery are the nerve endings in between these strings that get torqued and twisted when these get torqued and twisted that are in the middle of this kink or where that kink is caused.
Hmm. Of course, it's totally brilliant, Hal. I totally appreciate it. And of course, I've been a patient of yours as well and had some amazing trigger point injections that have cured me of pain instantaneously. I want you to speak a little bit to number 5 again, the 90% of the time one, the idea that the pain. Can you say what you said again with number 5?
Yeah. Let's expand on that because everybody who's watching this can touch it and feel it in their own body. And
Mhm.
it's really simple. There's a muscle right here in your neck. It's about the size of your thumb. You can grab hold of it, face straight ahead. You can get your fingers around it and you can pinch it and you can feel there's ropes and cords in this muscle. And somewhere between the back of your head and your collarbone, they're surprisingly tender. Wouldn't
Yeah,
you agree?
I w
And then touch the top of your collarbone, push down on it, run your finger across the top. You'll feel little irregularities that are also surprisingly tender.
yeah, for
This
sure.
on your collarbone is the injury that causes the strings to kink in your neck. And the first time you got that injury, you were an infant, and somebody picked you up by your shoulders, forgot to bring your head. Another time, you were on the playground and some little kid came up behind you, shoved you to the ground, snapped your head back, and tore where the strings and cords that go through this muscle weave and anchor, that anchor I was talking about, through the cover over your collarbone before they come down into your chest. Take your hand, get a big bite of your pec muscle, run your thumb across that, and feel the ropes and cords in there and how tender that is.
Yeah.
Those are the injuries that you got the first time when you got up off that playground floor and pushed that little kid back.
Mm.
And then you can think of hundreds of times, like when you did planks in the gym or when you did too many push-ups in 10th grade. And the list goes on and on. This injury makes these kinks, and these kinks make a pain pattern that you identify as migraine and something we call trigeminal neuralgia. It doesn't come from your head. And if you grab hold of these where they're tender and you give them a firm, gradually increased pressure, you'll feel pain go up to your eye and across your forehead as you do that. And all you've got to do to make that pain go away is unkink these strings. You have this ropey band across your upper shoulders. Everybody's got that, right?
Mhm.
You squeeze on it, it hurts. You know what we're talking about with the soreness in the upper shoulders, and you get massaged and they feel better. The reason these muscles are tight is the same thing. You're strong enough to contract this muscle to lift and carry your book bag. Yeah, it goes all the way back to then. Carry your suitcase, your briefcase, take out the garbage, hold up the world, right? But where the muscle anchors peripherally and centrally isn't strong enough to hold you together when you pull that hard. You tear from all four ends, two on each side, and twist into these. That's why they're tight. The reason they're really tender and glued together on the inside is what your immune system does to light up the injuries of a lifetime for 3 to 5 weeks when you have the smallest, slightest amount of dairy from cow. So the sum of your pain is the injuries of a lifetime compounded with what your immune system is doing in reaction to inflammatory things in your food and environment that cause things that we should never be exposed to.
Mhm.
So we minimize the exposure. We show you another way to eat if that's important and necessary. And we show you how to unkink these strings. And then we help you unkink them from the inside and heal how you anchor and hold together so that the next time you pull, you don't kink and hurt again. Here's another one that's really fun. Have you ever noticed that men lose their butt when they get older?
Yeah.
It's not just because it gets chomped on by their boss. It's not just because it gets chomped on by people that love them and whoever that goes, including their kids, because everybody takes a piece out of dad.
Mhm.
But there's a rule, and the rule is your body will not let you get strong enough to tear yourself apart from the inside. And so, how did men hurt themselves? Especially with the tendons that hold your butt together? When we were young, we jumped down the steps, and many of us can remember how many steps we could take in one jump because it was a badge of courage. And you were always challenged to take one more and then roll it out at the end if there wasn't a wall in the way. And then we jumped out of swings with an arc, and that wasn't enough. Many of us jumped off the roof. And I'm just talking about the first story. And when you land, there's two things we cannot defend in our biology. One is bullheadedness, that women call stupidity because it's mostly men who do it. And that's the guy who is way too old to curl this much weight, has to do one more rep and shreds his biceps, wanders around like Popeye forever. You can't defend that. And the other thing we can't defend is impact. And when we jump and we land, we tear the anchors just like this that hold our butt muscles to our body. And as we get older and that tissue becomes less resilient, our body actually atrophies our gluteal muscles. So we're not strong enough to tear our tendons without impact and bullheadedness.
Mm.
And that's why we lose the form. And if we help repair those anchors that we call tendons and we make them stronger, if you're young enough, you'll actually regrow your butt. We've seen
Wow.
that happen. We've actually
Exciting.
seen that happen.
That's amazing. It's really awesome. So tell us a little bit, like this, these are not theories. These are in your way of being. This is just simple truth at this point. When I said see the truth, these are some of the things that we should know as the truth, which are entirely different than what we learned in medical school or what most of our, we'll say clients, patients, customers are learning from the people that they're showing up for in an effort to get help with pain. Instead, what we're learning here is really what causes pain and how, of course, it's entirely sensible what you're describing. It's based on a truth that far exceeds anything that is so complex that makes it into the journals. Instead, what we're talking here is simple human mechanical truth, like a natural physics of what we know to be real.
Pain is
And
an engineering failure.
exactly. And that's all we're really talking about. And How does that apply? What should a person know? Not everybody's going to be able to see Hal Blatman. So, what can a person know on the pain that they're presently experiencing, or maybe even more importantly, how to preemptively protect themselves from feeling pain in the near future? And what can people do to prepare themselves for pain or else deal with pain that already dominating their life?
We're working on that. And here's some things to start it out. Number one, you can go to our website, blatmanhealthandwellness.com, sign up for the newsletter, and get the Do Not Eat list. If you just follow the Do Not Eat list and take the inflammatory foods totally out of your diet, half your pain could go away like it never existed in the next 6 weeks. Could.
Mm,
We've seen better than that happen. But you have to understand that the word totally is really the important thing here,
mm,
because
mhm.
people go, I'm mostly gluten free. I don't eat much cheese. I don't eat much dairy. I only a little. Excuse me. This is an immune system issue. And if your immune system was sensitive to bee stings, how many would it take to kill you? Less than one. That's how
Yeah.
much butter you get before your upper traps glue together for 4 weeks. The penalty is steep. And when your body makes you hurt, you got sent to your room. And now your job is to figure out what you did. Just look on the Do Not Eat list. It's right there, especially when you
Mm,
start out. And then figure out how long am I going to be there? And it's anywhere between 4 days and 4 weeks. A banana is going to make you hurt for 2 days.
really?
Bite of mashed potato is going to make you hurt for 4 days.
Wow.
You want to feel good, you've got to make a deal with your lips. They don't let anything by, but your eyeballs haven't read the label and your ears haven't heard the server go, that's okay, by your specifications. And you learn those specifications from the Do Not Eat list.
Mm,
Another thing is, you can take a look at my book, Winner's Guide to Pain Relief. It's offered on our website. You can buy it from Amazon for $80, but we're a lot cheaper. I've actually seen it for way, way too much money. But the point is, the book shows the map of where are the kinks and where's the pain they cause, and how do you take a little rubber ball, push on those kinks, roll them out, and make them go away.
mhm.
And one of the reasons you get a massage and you feel good is because you're unkinking yourself. And one
Mm.
of the reasons that pain comes back is you glued right back together again. And how fast you glued back together is more about your food than anything else.
Fascinating.
If you can tell me that last 3 or 4 weeks, you're great. If you tell me that by the next day all your pain is back again, or most of it's back again, take a look at that Do Not Eat list. It's going to save you a lot of aggravation.
Now
Now you
you
take
mentioned,
a look.
yeah,
You
you
learn
mentioned bananas and mashed potatoes and gluten. And what are some other surprise foods that probably most of America's eating that's getting them into trouble with pain?
You know, number one that really surprises people, I think, is dairy from cow. The cream you put in your coffee, you can't do it. And the artificial coffee creamer, you can't do that either. That's actually a poison.
Mhm.
So now you're into other substitutes. The best one we found is Laird's coconut creamer, and coconut cream in a can are the best things that we've found. But that takes a workaround. But to know that even the tiniest amount of butter will put your immune system in a tailspin. Ghee from grass-fed cows you can handle most likely, no matter how sensitive you are. And that'll give you the taste and the fat of butter. So these are the kinds of things we talk about. And everybody says, well, eat less white stuff and eat more of this and more of that. Nobody says you have the tiniest speck cross-contaminating your food and you will be sent to your room for days. So pain does not fall down from the sky. Most of us are worried our back's going to go out if we do something wrong. Your back didn't go out. It's what you ate last night that made your back go out when you picked up a Kleenex at 10:30 this morning.
Hmm.
It's most of
So
it.
interesting. So interesting.
If you have pain in the morning you didn't have when you went to bed last night, and you don't remember sleepwalking and getting hurt last night, it's almost always last night's food. and it's on the do not eat list, and you could have made a better choice.
Mhm.
And your body sent you to your room, and you're going to go and get a surgery for that because you don't understand that it's not coming from your disc. And you don't understand that everybody's telling you that disc they see on your MRI is significant. And I'm telling you, it's not. Discs don't do that, except every once in a blue moon. And every once in a blue moon, there's success like that in surgery. My mother is one. She bent over and hit the Kleenex. She ate food like that all the time. So I don't know that one night was different than the other. She had a herniated disc, pain going down her leg. The disc was removed. She was up walking the next day and never had pain again in her life. Everybody knows the story of that every once in a while. But most of us, the only thing you can believe is what you can touch and feel. Where are you tender? And did the surgeon ever really touch you?
Hal, give me a few minutes on what in your youth or what in your pre-medical school or even maybe even pre-college days. I know a little bit about your history and the bumps and bruises you took in order to become where you are, but how about if you give our listeners a little ride of how does Hal Blatman become this unique doctor figure that you've become over time? What happened to you?
You know, I was always encouraged to figure it out. And I could have gone into other things besides medicine. Medicine showed itself, and my prime directive in high school was I wanted to never be bored. And I spent a lot of time in high school bored, really
Mhm.
bored.
Yeah.
And I didn't want to spend my life that way. And I realized that there'd be enough stimulation in medicine that I could find something I liked and I would never be bored. And I wouldn't necessarily be wealthy, but I would always have food on my table. And that kind of got me to cross the line and gave me the drive to do it. And I'm actually in my fourth career since I
Yeah.
graduated medical school. I evolved from one to the next. And I think what drove my bus was that I hurt my lower back on the Nautilus low back machine in the 1980s. And had 2 years of orthopedic surgery training behind me. And I was reading this orthopedic journal a few days after I hurt myself. And the doctor was talking about physical exam techniques you could do to tell that the patient was faking. And as with low back pain, that's a big deal in medicine.
Yeah.
And I realized at that moment that I couldn't pass the test. This guy would think I'm faking. And I had not yet my first pain-free moment. I was that miserable. And I realized at that moment that all these people that were writing articles about pain, none of them had a clue what they were talking about. And none of them had ever hurt their back. And none of them had any idea. And I knew I didn't either. My orthopedic training steered me astray like it steered everybody else astray. And it wasn't just orthopedics, it's all of medicine, all of physical therapy, all of chiropractic, not all of, but most of. And I went on a search to figure it out. And I figured it out little by little. But I'll tell you, if I had known 30 years ago that gluten and dairy played such a big part, I would have never learned the rest because I would never heard enough to figure it out. And as I did trigger point injections and felt better, I knew that was a big piece. But then when I started to regrow tendons and make tendons stronger and fix the anchors, the trigger points didn't come back. And as I fixed the food, I did even better. And I'll tell you, it's been a tremendous journey. The last thing I took out of my diet was 4 months ago. And I am so much better now than 4 months ago. It's again another transition because, as you might know, you never know how much you hurt till it doesn't hurt anymore and the pain
So
is
true.
gone.
So true.
And every step of the way, I thought I was like so much better. And gosh, is this nice? But I still hurt. And every step is just that much better. And I made my most recent step 4 months ago. And I started this journey 25 to 30 years ago. So I'm learning it as I go, as fast as I can. And I teach it to everybody I can show it to.
So, of
Yes.
course, Hal, we got to know what was the thing that lasted until 4 months ago.
Goat, sheep, and buffalo cheese.
Goat, sheep, and buffalo cheese.
Now, you're not going to feel it if you're still eating cow cheese. You may not feel it if you're still eating gluten. You may not feel it if you're still eating sugar. But I took that out of my diet and I'm a world better.
Fascinating.
My golf game is so much better.
Your golf game's always been pretty damn good, Hal, just to let you know.
The last few years, it has not been that good. But I
Mhm.
just bested my best game by 7 strokes the other night
Wow.
because I can move and I can turn and I don't hurt.
Wow.
And it's really fun.
Yeah.
Got to
Cool.
admit. And
Yeah.
everybody can do it. This isn't
That's
magic.
awesome.
It doesn't
That's
take a lot
yeah.
of money. So we're going to show videos on how to work on your partner and how to spread the word and how to make this count. And if you have a really difficult problem, you can make it to Cincinnati or Manhattan, and we can start to help work on your body and help to restore it. And as quickly as you restore, a lot of this pain can go away.
So you mentioned Cincinnati and Manhattan. That's how people run into you live. And if they're going to get access to you, is this the Blatman Health and Wellness.com? Is that where they naturally go? And then is
Yes.
that where they can connect with you?
Yes.
Okay.
And that's where you'll find our contact information. That's where you can come. You can learn a lot about what we do. We even talk about stem cells and PRP. There's a lot of things that we don't talk about on our website because we don't want to talk about them on our website, but you'll learn about them when you come.
Interesting.
Yeah. So don't
Yeah,
think that because you don't see it on the website that we have no knowledge of it.
exactly. Yeah. It's a funny industry, isn't it? You have to be a little bit careful at times with what you say inside of our industry. And it sounds like you know that. I certainly know that from a psychiatric standpoint.
Yes.
Hal, as usual, an amazing conversation. So I really appreciate you. I love you dearly. And I want to ask you if there was one more thing that you felt the general public. Look, you've already said many of semi-shocking things, if not truly shocking things about food, about gluten, about even alternative cheese like goat, sheep, buffalo cheese, and every bit of dairy, including butter, and then not to mention bananas and mashed potatoes and these kind of things, and that it all comes from food in many ways, as well as past injuries. And you've made several, claims here that I firmly believe to be entirely true and way more sensible than anything I learned in medical school. But now I'm asking you one more piece, which is, what do you want to tell everybody? If they have one thing, what do you want to tell the public about either who you are or who they are or what life's about? Is there one thing that you can synopsize or summarize that you would want to tell each and every person out here?
The reason I go to New York is because my son told me years ago that if I really want to change medicine, I'm not going to be able to do it from Cincinnati. I'm going to have a much wider exposure. And and I'm not going to be 90 years old and wonder if I could have. I'm going to be 90 years old and know that I gave it everything I had.
Mm.
So if I can do anything and ask people to help, it's going to be to spread the word to help mankind get out of pain. Show the world that there is a way and that there is somebody who knows some of the answers and can help point us in the right direction and get us going, because there's people who are going to come after me that are going to learn even more. And I didn't make this up. I learned this on the shoulders of greats. I was mentored by Janet Travell, who was one of Kennedy's physicians in the White House. I did not come upon this on my own. I learned a lot on my own. I figured a lot of it out that hadn't been figured out before. But there were a lot of shoulders I stood on that were great people and still are great people in my memory.
Love it. Hal, wonderful conversation. Thank you so much. And it's really been a pleasure. And for all of you who've stayed on for this show, thank you for being here. This is my buddy Hal. Hal and I grew up. Actually, we didn't grow up quite close.
We grew up as young adults. That was actually growing
grew
up.
up as young
We
adults,
did
for
together. There's no question, Fred.
No question about that. We definitely did that. And it's always been a pleasure. It's always a thrill talking and interacting with Hal. And I hope you've enjoyed it as much as I have. And if so, I'm going to ask you to either comment or share or maybe even subscribe to the Healthy Healer and make sure that you visit Hal at his website. And if you really want the help that I've received in the past with trigger point injections and other forms of treatment that makes a lot of sense, but isn't what we were taught, check them out at BlatmanHealthAndWellness.com. Hal, thanks for being here. It's been lovely. We'll catch you on
Fred, thank you. Be well.
the
Hi there, I'm Dr. Hal Blatman. I have medical offices in Cincinnati, Ohio, and Manhattan, New York. And what I'm here to talk about is that pain is not what we were taught. People suffer in chronic pain needlessly. People go to the doctor expecting to help, and your doctor never even touches you. Well, there are real answers for real problems in chronic pain, and they're not what we were taught. Most of your pain is not coming from your disc. It's not coming from your nerves. It's not coming from inflammation as we were taught to understand it. It's coming from a lifetime of injuries to the fascia that holds you together. And you can be shown how to change that fascia with your bare hands. You can be shown how to help your body heal, and we can show you what we can do to help your body heal when your body doesn't have the tools and resources to do that. I've included some of this in an article I just wrote for New Holistic Life magazine. I encourage you to get a good read on that. I'm Dr. Hal Blatman, wishing you a very nice pain-free day.
Hello and welcome back to A Better World. This is your host, Mitchell J. Rabin, and I'm very glad you're joining us again today. Today we're going to have a very interesting show. I have invited Dr. Hal Blatman on. Hal is a specialist in pain, one of those things we rarely like to talk about or deal with. Yet, he has found ways of dealing with it and understanding it that have changed the field. And he has an extraordinary background, actually, in pain management. He's written a book on the subject. He's traveled the world giving lectures on it. And he's here today to educate us about the nature of it. And we can learn a lot. I've been learning a lot just recently about how to understand what it is and what we can do about it. So, Hal, great to have you.
Mitch, wonderful to meet you too, and wonderful to be here. Thank you so much.
Absolutely, my pleasure. So you've been educating me about this. Now I'd love to educate our audience about another understanding of what pain is and where it comes from and what to do about it. So where do you want to start with this?
Well, let's start with some of the things that we've been taught that aren't so true, just to kind of level the field.
Yeah, please.
Because we've been taught that pain comes from inflammation. We've been taught that pain comes from nerves being pinched by discs. We've been taught that bulging discs might cause pain. All those things. And most of what we were taught about pain is not the way our biology works.
But does inflammation cause pain?
Inflammation causes a reaction in our body that makes pain worse. So yes, inflammation can cause pain. But at the same time, our bodies are designed to have inflammation for two main reasons: for repair and for defense. If we have inflammation that's causing us pain, we have a repair deficit. We have an injury big enough that we're not able to repair it, and our biology has to shift to a defense mode and make us hurt.
Oh, as a signal.
As a signal.
Okay. So you're making a point that I do know about inflammation, because we tend to just say to that inflammation, and that's not the case.
No, we don't want to.
It serves the purpose.
Right.
It serves, as you said, the repair purpose, etc. It's just that when it gets excess and is not doing the repair, then the pain signals start in.
Yeah. Ankle sprain is a good way to think about that. What are we taught to do with ankles? We're taught to ice them and wrap them and elevate
Heat them.
Right? Ice
and nobody knows what to do. You know, there's a bit of a toss-up about which direction to go in.
So this may help level the field. When you sprain your ankle, what does your body do with it? Does it warm it up or does it cool it down?
Heats it up.
Why does it heat it up? Couple reasons.
To bring blood to the area?
To speed up metabolism, because you warm things up, they metabolize faster.
Yes, right.
And to increase blood flow, because that's going to speed up healing. Don't you think our biology, in however many thousands of years we are old, maybe 30,000, don't you think by survival of the fittest, if that was really going on, our bodies had figured out how to heal us as best they could without the surgery in the hospitals and stuff? And so your body heats it up because that's the right thing to do. If you cool it down and you go home and put ice on it and take anti-inflammatory drugs, you've just stopped
the body's natural inflammatory process, which it needs for the healing.
and now you're not going to heal as well. You've just taken away your potential and ability to heal and decreased it. There's a wonderful study was done several years ago giving Army recruits.
Let's appreciate the irony of that, Hal.
For me.
Right? Exactly. It's
But there was a
how
study
did that
done,
happen?
and these army people were given meloxicam, which is an anti-inflammatory drug.
Mm-hmm.
And those who took the drug got back to work faster, had less pain and less swelling, but 6 months later still had unstable ankles that were uncomfortable because they never healed.
Removal of the symptoms, the pain symptoms, and no healing.
Right. So you want that part of inflammation.
Yeah.
You don't want the inflammation that causes you pain. Well, it turns out a lot of the inflammation that causes pain is a reaction in the fascia that holds us together caused by the food that we shouldn't be eating.
Okay, so the plot thickens.
The plot thickens. So
Okay.
aside from the injury, which we still haven't gotten to, because
Mhm.
that's really the source of the pain, what makes those injuries light up, like you just plugged them in and set all the light bulbs up,
Is the
is
food,
that
inflammatory
causes an
based
inflammatory
food.
reaction in your body that you should never be eating.
And those foods are?
Bread flour, sugar, potato, fruit juice, artificial sweeteners, fake fat,
All my favorites.
all the things that are not
I'm
real
kidding.
food,
Yes, right.
right?
Right.
All the things
They're
that are not addictive,
real.
but they really nutrient. Yeah, the things that nutrient you don't do that.
Right.
Things
Nourish.
that cause the inflammation that don't nourish you as well. They may keep you from getting skinny, and they may keep you from looking like you haven't been fed. And they may make you really big, the opposite of looking like you haven't been fed.
Right.
Because those foods that we just mentioned, we call big people food. You can never be a big people eating little people food, right? You have to be, and the big people food causes inflammation that makes you hurt.
So interesting. So pain would almost be subacute had it not been for these inflammatory foods, which really light the whole thing up.
Even more so, and just to drive that point home a little bit, I have done this experiment where once a year I've gone out and skied. Now, I used to ski when I was a kid, so I've got a skill set, but I haven't done it in 20 years. And so I put skis on and think I could do what I used to do when I'm no longer strong enough to do that. But you can imagine that I pulled on my strings pretty hard, and I really worked at the skiing.
Yes.
You get out of the car after the hour drive home and, oh, you know how that feels. And you're worried about the next day. And I went home and I took my warm shower and massaged my muscles and did all the things that I woke up the next day fine. Not because I didn't have any injuries from the day before, but because my food was so clean that my body repaired those injuries under my radar and didn't even let me know that I was hurt.
That's very instructive.
And to make sure it wasn't a fluke, I've skied 3 years in a row, 1 day a year, and repeated it 3 times.
Painlessly.
A little bit of discomfort, but nothing like what you would expect from doing a very strenuous activity that you're foreign to because you haven't been warming up or, you know, just go right into running a marathon.
Sure.
You should be pretty miserable the next day. Except for I didn't eat any of the food that would have inflamed my healing response, and my body just worked at healing.
So this is a slightly altered understanding of the mechanism of pain. When someone comes to you, Hal, what happens? Give an example, if you would, please, of, you know, maybe someone in particular who came and got your treatment and has been suffering for umpteen years, and then all of a sudden, voila, some changes.
So most people have an idea of where their pain comes from. They've seen other specialists who give them also those ideas. So the first thing I want to do is listen to what you've been told and what you've learned, and then also hear how your body has progressed, if it's progressed, rather than going backwards. And then the key is, I need to touch you. And you'll find, or what I find, is that many patients who have pain, the doctor has never touched them. Their diagnosis has been by X-ray, by MRI scan. Your chiropractor looks at you, he touches you, because he has to adjust you. But your diagnosis is the X-ray and what he reads on the X-ray, and then what he feels secondary. Your orthopedic surgeon doesn't really touch you. Your orthopedic surgeon and your neurologist pokes you with needles to see where you're numb, then orders an MRI scan and an X-ray and shows you where your disc is pinching on a nerve and that you need surgery, and still hasn't touched you.
As a therapist, a counselor, and acupuncturist, I'm deeply offended by this fact. It really is. It's someone who has been in touch with, no pun intended, the healing power of touch.
Right.
And knowing how children need to be touched,
Right.
or they do not get proper brain development. I mean, that's how serious and important touch is in infancy. And you can just extend that same understanding forward for the rest of one's life.
Yeah.
And oxytocin release, etc. That's
And
how
one of the
important.
most bizarre things I ever heard in a pain conference was a specialist from the American Pain Society who said, we encourage physical therapists not to touch the pain patient because then the pain patient will want to come back to therapy just to be touched and they won't ever be discharged. Isn't that sick?
Profoundly.
Profoundly. Well, that's what our colleagues have been taught for all these years. And what we're trying to show is most of what we were taught about pain is not the way our biology works. And if you think about it a different way, most of the chronic pain people suffer with can actually go away. And that's what we're here to talk about.
Exactly.
An entirely different paradigm.
So go into, if you would, an example of someone that you've worked with. They come in, they've been getting standard conventional treatment, it's not working, and those are the people I imagine are coming to your doorstep.
Yes. Headaches too.
Mm-hmm.
And headaches don't come from your head. And if you can touch the piece that sends off the headache and people realize, oh, that's where my headache is.
Oh, yes.
And just do this and see how they go away and they don't come back. That means changing your food. That means working on your body. That means unkinking the fascia from the injuries that you've had through your lifetime. So the most important part of what I do on the first visit is to touch.
Mm-hmm.
And you'll find that we have a skill set that we've developed that we can also teach, that I can touch your body and by your texture, the texture of your fascia, know where your injuries are through your lifetime and know where you're tender without you having to tell me where to find it.
Well, the body is telling you.
Your
The
body
fascia
will tell
is
me.
telling.
So I will usually introduce that by,
Sure.
let's find out two things. One, let's find out what your body can teach us that you may or may not know.
Right.
And second, the most important thing, let's find out if what I feel on my side of your skin is the same thing you feel on your side of your skin without you having to tell me. Because once you know that I feel what you feel, the average chronic pain patient goes to a new doctor with one thought in mind, or I need to convince this doctor that I really have a problem, that I'm not faking, that my pain is real. That is a major concern of people with chronic pain, whether they're going to be believed.
It makes sense, because the other side of all of this is that pain is very subjective.
Right.
And it's
And
not
it is.
measurable
Your
as
experience
such.
of it is subjective.
That's right.
Your injuries are not.
That's right.
And if I can show you them, and as I'm touching your body, you go, wow, how did you know that was tender? I didn't tell you. And you realize that I know what's going on in your body, and that changes our relationship in the first 10 minutes.
Absolutely. So you were telling me, Hal, about a woman from Long Island
Yes.
who recently came.
And she's had pelvic pain and headaches and pain all over her body for a long, long time.
Yes.
And she's been in therapy for a long time. And
Physical
her physical
therapy.
therapist sent her to me.
Mm-hmm.
And I find these injuries all over her body, show her where all this pain is coming from, and then I take out my tools of the trade and unlock the fascia strings that are binding her and holding her in pain. And now this is 4 weeks later, and so much of her pain is gone from that one visit. And what she's been able to do in physical therapy is remarkably different with the strength and the exercises that her therapist has her doing. Another real profound success is a woman with rheumatoid arthritis. She's in her early 30s, so she got it in her early 20s. She had too many vaccines at one time, is what it's been attributed
Oh, my.
to. And by the time she gets to me with this 10-year history, her fingers are going sideways, her knuckles are swollen. She can't move this elbow. If you look at the x-ray, you almost can't see the bone. It's so faded, there's not enough calcium. And she moves it by holding her other hand. And I have to put needles and do work on her arm, and I can't move her elbow. She has to. That's her first visits with me. This woman has had platelet-rich plasma, stem cells, peptides, a very clean diet, all herbal medicines, everything we could do. And now it's 3 years
Since she
later,
started coming
since
to
she
you.
started coming.
Mm-hmm.
She can wear gloves on her hands now she hasn't been able to wear in years because her fingers aren't so swollen. She came in last time, she can actually move her elbow without the other hand holding it.
Can you see the elbow now?
We ordered x-rays. We're hoping
Okay.
we can see the elbow.
Uh-huh.
She's able to work 2 jobs, and 3 years ago she was an invalid. She couldn't work at all. And the people that the society where she belongs
Mm-hmm.
have decided it's better to spend several $1,000s and help her body recover and restore from this awfully devastating process and make her a productive member of their society rather than having to support her as an invalid for another 60 years, paying for her medical care and her doctors and her drugs.
And that she's depressed because she can't do anything.
And even if she lives that, and then she can't cook for herself, right. And now she's no longer crippled. She can work 2 jobs. And she had a really bad case of rheumatoid arthritis, and her biology is restoring her body and putting it back together as best as it can.
Because that's what biology does.
Exactly. And with the work that we've been able to do, she's making this happen. Well, this is true not just for headaches, but for pelvic pain, for the pain you think might be coming from your prostate. You know, if your doctor suspects a prostate infection, antibiotics might be the right thing. But 6 months of doing that, it can't be an infection. Something else is causing the pain. And nobody knows how to touch you, and nobody knows where to look for it.
Well, you're bringing up a whole interesting subject that has interested me forever because I've been studying the body in many different ways through the lens of Chinese medicine, and because I was exposed to Rolfing very early in my life. When I was a teenager, I came to appreciate the power and role of fascia. Yes. Not nearly as developed as yourself, of course, but
Rolfing is at the core.
Had I had a kind of a view into the structure of the body, and not to mention body language and posture language and all of that, and what it says, speaks, and how we hold ourselves, etc.
Hi there. Using this rubber ball, you can do a lot to massage your own body. Myofascial release makes some of your pain go away. I like to use this ball against the wall, and I can use this ball to reach parts of my body my hands can't get to. My shoulder blades, the muscles over them, and my gluteals, my buttocks, are the 4 most important areas in my body for generalized aches and pains. I start this by putting my butt right on the wall. I can take the ball up here, set it on top of my shoulder, and just by leaning forward little bits at a time, I can drop that ball down and send it exactly where I want it to go. If your butt's not on the wall and you try to do that, you'll be trying to keep the ball from landing on the floor. So, secret, butt on the wall. Drop this ball down. I send it down to my bra strap. That's a good general place to go. Then stand off the wall, move your feet, maybe a foot, 1.5 feet from the wall. And then you can go up and down, covering this muscle between your shoulder blade and your spine. And I like to do this limbo. Get your belly going out, your knees going out, tilt your head back, and you can get across the upper traps just like that. And you can even just keep going like this. And that covers the muscle from your shoulder blade all the way down to about the tip of my thumb without having to go up and down and use your knees. Then I turn the ball 45 degrees, Then I turn my body 45 degrees to the wall, and I want the ball to cover my shoulder blade from the bottom to the top. So I'm going to go against the wall. Take your arms for this position and put them across your chest and tuck them in like you're mad. If you don't have your arms tucked in, your body's going to be all over the place. If your arms are here holding on, your shoulders are going to be hiked and tense. The only way your shoulders get to relax, tuck your arms in like you're mad at somebody. Place the ball at the bottom of your shoulder blade and start doing this wiggle dance. And you'll find that you roll over this really tender rope right about there. You can stay and lean right on it if you want. You can go up and down just on it if you want, but you can also just do this because some people find leaning on it to be a little too uncomfortable, especially when you start out doing this. Now, just to see the other side, drop the ball down, You can go up and down. I like to do this limbo piece because this takes care of that cord that seems to go from your shoulder blade up your neck. And then I like to just come here and get across the top of my traps, and then 45 degrees, and do this wiggle dance to get the muscle over your shoulder blade. Right. Hi there, I'm Hal Blatman, MD. Do you have pain in your lower back? Well, where does it come from? It feels like it comes from your lower back, but the only thing you can believe at the end of the day is where you can touch and feel. Where are you tender? Are you more tender here, where your lower back muscles are right above your hip bones? Or are you more tender here in these muscles next to your spine? Or are you more tender here in your butt muscle? And most people with pain in their lower back, this is where the tenderness is, not here. And if that's true in you, then most of your lower back pain is not coming from your disc, your spine, or your nerves. It's coming to the injuries from your childhood and through your lifetime to your butt muscles and what holds you together in the lower part of your body. Hi there, I'm Hal Blatman, MD, and I'd like to take just a minute and talk to you about head and neck pain. Are you able to take this muscle, just wrap your fingers around it? It's a pretty big muscle. And can you feel there's ropes and cords inside this muscle? And can you also feel that they're surprisingly tender in some places? Now, take your finger and touch the top of your collarbone. Push down and massage just the very top, and you'll feel little irregularities that are also surprisingly tender. Well, this is the injury that causes that. And the way you got that injury, you might have been an infant, and somebody picked you up by your shoulders and forgot to bring your head. Another time it happened, you were in nursery school, and somebody not happy with you came up behind you right before morning recess and shoved you to the ground, snapped your head back, and tore where the cords and strings that go through this muscle weave through the cover of this before they come down into your chest. And the results of that through this time, here's one end of the injury, here's the other end of the injury, here's the kinks in this muscle, and here's the pain pattern of headache that causes. Hi there, I'm Hal Blatman, MD. The muscle that controls this finger starts all the way up here. If you touch this muscle and come across it, you can make that finger move. This is tender, this is more ropey and more tender, this is less ropey and less tender, and here it's gone. All over your body you'll find this texture is not tender and this texture is. Representative of the injuries all along here. When you pull hard enough on this anchor and the strings or fascia cords slip, they twist into a knot when the cable snaps, and this knot, if big enough and bad enough, will send pain from here all the way down to your finger. Hi there. Do you wonder if you have carpal tunnel syndrome and how could you tell? Well, a lot of people, doctors, want you to go get an EMG test where needles are put in your arm and shocks are put through your nerves and muscles to measure how fast the current goes, knowing that if you have a blockage and a pinch on that nerve somewhere, that the test will be abnormal. But in actuality, that's not the best test for carpal tunnel syndrome. When I reviewed the literature a few years ago, the best test for carpal tunnel syndrome can be done at home, and it's incredibly simple. Just take your hands and drop your wrist. That makes the room in this carpal canal a little bit smaller, and if these three fingers go numb or tingle or hurt more in the next 45 to 60 seconds, it's a pretty safe bet that that wrist on your body has carpal tunnel syndrome. No needles, no fuss, no hospital, and probably the most accurate test that we have. Now, if you do have carpal tunnel syndrome, where did it come from? If you go listen to your doctor is going to tell you what he was taught or she was taught in medical school, and that is that when you do a lot of this repetitive motion with your fingers, the tendons in this canal get inflamed, that extra swelling pushes on the nerve that we're talking about, and a pushed on nerve is not a happy nerve, and you end up with the symptoms of carpal tunnel syndrome. However, when you biopsy those tendons during the carpal tunnel surgery and you send that to the lab, there's no evidence of that supposed inflammation. So maybe that theory doesn't really hold water. A much more important thought is that in order for you to do this fast work with your fingers, you have to hold your wrist still. And to hold your wrist still, you have to have a sustained contraction of this biceps muscle. If you do that, the biceps muscle ends here, but the fascia does not, and it goes all the way through to here. And this fascia tightens, and then so does the ligament. So it's not that the structures inside swell and get larger and there's no room. It's that the canal actually shrinks and gets tighter, pushing on the tendons and on the nerve. There's one more theory for carpal tunnel syndrome, and that is that many of us through our lifetime have used our hand as a hammer. And the nerve we're talking about runs right behind this ligament that crosses over your wrist. If we go look at Fred, Fred has the same ligament right across his wrist. And the nerve runs right behind this ligament down into the fingers. The surgery in carpal tunnel surgery is to make an incision through the skin, cut this ligament, sew up the skin, and send you home with a splint. So let's get back to the third mechanism I was just talking about. And that is that there can be adhesions and scar tissue between the ligament in front and the nerve that's supposed to move right behind. And if there's stickiness between the ligament and the nerve, the tendons are supposed to move through this canal when you move your fingers, and so is the nerve, because it goes all the way out to your fingertips. And if the nerve gets tugged on because it doesn't move well, a tugged on nerve is going to give you the symptoms of carpal tunnel syndrome. That surgery is much different, and that's something we do in the office, requires very little of anesthesia. We make the skin numb, we put a needle in through here, and we separate the nerve from this ligament, injecting fluid, done under ultrasound guidance. And the results are incredible. The results with carpal tunnel surgery, 50% of people get better and 50% don't. And 30% of them do not have a very good, happy ending. The surgery that we're doing with the needle, we're showing 90% improvement. 30% of those people have had to have a second one because the first one didn't do enough, and we have 0 bad results. If you're looking for help for your carpal tunnel syndrome, there's another way besides a needle, besides a knife. If you're looking for help for your carpal tunnel and your carpal tunnel syndrome, there is something much easier to do than a carpal tunnel surgery with much less rehabilitation. The hospitals right now can't really take you because of the coronavirus, and you can come and get this treatment. I'm Hal Blatman, and this is the way we treat carpal tunnel syndrome at the Blatman Health and Wellness Center.
At level 8 and 9. Up before then, I'd go, yeah, 6, it's no big deal. But when I got desperate, and I'm 79, so I'm aware that I may be totally disabled, and my independence is really important to me. And I was getting more and more restricted. I couldn't get out of my chair without thinking. I couldn't walk. I would like to walk to the bank and make my own banking, but I couldn't do it because I couldn't walk that far. It was too painful. I'm on the 3rd floor of my building. I would like to be able to walk up and down stairs, but I can't. I can if I really walk slowly, but I have to pull with my arms, and I'm afraid of falling. So these are all the things that improved. I'm getting better sleep. I can get out of my chair without thinking. That's so important. You know, what if I feel like getting an extra helping of things from the refrigerator? Nope, can't do it until maybe it gets to be more of an emergency because it hurts too much. I love exercise. I would love to exercise. I've had physical therapists tell me that I could avoid hip replacement by more exercise. I can exercise because it's so painful. I can't think or concentrate. I'm in so much. I used to be. Now I can concentrate. I did something last week that I could never have done before.
What was that?
I'm the secretary treasurer of a tennis club, and we had a very contentious meeting with people kind of wanting one thing and other people wanted another thing, and there was a lot of arguments, And I decided to write up, I'm the secretary, so I decided to write up a complete account of what everybody said. And I could remember it. I could write up the account and think of things that might help people, things that we could do for them. And it took me about 3 hours. I could never have done this before. Just would be too exhausted. I'm also able to bend down and pick things up. I'm not perfect at it, but before you would look at this thing that obviously needed to be picked up. I'm a good housekeeper. It would bother me to have globs of food on the floor. But I would just go, maybe I can leave that glob of food on the floor. Who cares if we get a few mice? And now I can clean it up. It may seem like a silly thing, but I do enjoy that. And also, my exercise tolerance. And you may think exercise tolerance, 1,000 push-ups, whatever. No, exercise tolerance means walking to the bank. It means being able to maybe do a few wall push-ups, maybe 2 or 3. After I did these things, a wave of tolerance, a wave of distress, pain, fatigue, it would overwhelm me, and I just had to give up on such activities, and I felt bad.
And you were saying you walked 5 blocks on the way here today?
Yes, not only did I walk, I sort of half ran part of it. I thought I was late.
And then you also were able to put your shoes on now?
Yes, I have extreme difficulty putting on shoes and socks. I kind of sit there, you know how you can get a little bit more stretch if you just kind of sit there. But let's say I'm in a hurry. It can't work. I have to take 10 minutes to put my shoes on because I'm in too much pain. And I managed to figure it out. But last week I was able to lift my leg and put my socks on. The socks are the worst. The shoes are better because they're open, but the socks are closed.
Mhm.
It takes 2 hands for the socks, and my leg won't rise. So I can do it, but I've been saying you're about 2 months from barefoot. It's so wonderful. I really, really appreciate it. The other thing is, I don't know if I mentioned I can go up and down stairs, but I used to have a lot of vertigo. I've had this all my life. I've been in pain most of my life. I had a whiplash injury. So I never thought that I would get this much improvement. I just kind of thought, I'll be happy if you get me from an 8, 9 to a 6. That'll be, and you've already done it. It's I don't think I've ever gone above a 6 this last week.
That's amazing.
It
Do you
truly
have anything
is.
you want to add? I'm so glad you're willing to share this.
Yes, I don't know if this is because of pain, but I found myself unable to concentrate. I couldn't get through this video, and I may be talking too much, but the ability to remember, marshal my thoughts, that has made a big difference. And also, I'm starting to get more energy. My husband died in 2017. I've always had very low energy. After he died, I was his major caretaker. I had no energy. I just had 0 energy. And it gradually got better. And then more recently, after COVID, I'm not able to do much exercise at all because COVID closed all the parks and the gym and everything. And as a result of constant sitting and immobility, I got even more pain. And I got more tired. So maybe tired is related to pain. So whenever I tried to do more, I would get vertigo. And if I tried to push myself, and we all should be able to push ourselves on occasion, like, maybe a friend wants you to stay up late night to talk a bit or something. I couldn't do any of that. My friends invited me to be with them, and I had to say, no, I can't be with you. I can't do anything after 6 p.m. If I'm out, what if I get that vertigo and I have to go right away. It'll take me maybe half an hour to get back to my house and I might fall down. And now I can do things like go to that meeting. That was an outdoor meeting at 7 p.m. It lasted for almost an hour and a half with everybody yelling at each other. And I was able to tolerate that without getting severely stressed. Most of the time I had up and down surges of I'm anxious, I have to do this, and then I'm so exhausted I can't do anything. And I'm more steady.
Hi, I am Tammy Kolschmidt of Thermography for Health New York, and I'm here today with Dr. Hal Blatman.
And I'm Hal Blatman, Blatman Health and Wellness Center in Cincinnati and Blatman Integrative Healing in New York City. And we're going to talk today about prostate cancer screening and taking a look at the mouth, because what goes on in the mouth actually seeds the prostate and increases the risk and the inflammation in the prostate that does this to men.
Yes, thank you. So before I started thermography, I was actually a dental hygienist. And looking in the mouth, I would see so much inflammation. And I wanted a tool that would allow me to look at the whole body to actually see where else there's inflammation, because I know if it's in the mouth, it's somewhere else in the body.
Mm-hmm.
So that's where thermography comes in.
Because you can actually see heat, and heat reflects blood flow, inflammation, and all kinds of other. It can even reflect how hormones are not balanced in the body.
Correct.
So what can we see with the prostate in thermography?
So what I'm mostly saying, when I do a prostate imaging, I look at the gut, right? Because that is part of the mouth, 1, 2. I also look lower at the prostate and the testicles. So we are looking for heat imbalance. And oftentimes you'll see a prostate marker and the man might say, well, but my numbers are fine.
Right.
The thing of it is thermography picks things up often before blood tests do, before the chemistry starts to shift.
Right.
You can see a temperature change.
Which is when you want to see it before you get any of these symptoms. So you're going to pick this up before there's even an ill health effect that can be determined. Correct.
Yes, because again, with thermography, you can see things that you do not feel. And you tell me you're the MD, but isn't it, by the time a man feels like there might be a prostate issue, isn't it a little bit already inflamed and swollen?
You know, it's like the principle of driving your car, and you like cars.
Yeah.
When the red light goes on your dashboard, is it really a new problem? Exactly. Or has it been a problem for a long time, and then all of a sudden, the straw that broke the camel's back, and now you've got a light? Well, yeah. Your light in prostate is your PSA test goes high, and you've got a Gleason score and a prostate cancer. And so this looks under the hood at what might cause that prostate inflammation. And if you're a man who's already got prostatic hypertrophy, you've already got some urinary issues, we can look at that, see that, make changes in the mouth, we're going to talk about in just a minute, and reduce that inflammation in the prostate and reduce those symptoms before you get into more trouble.
Exactly. Well said. So let's go to the mouth, because I think you covered it with the prostate. When we're looking in the mouth, we're looking for hidden infections below the gum line, but it could also be an infection in a tooth or in the bone. But the key is that those hidden infections cause an inflammatory cascade. And honestly, like you said earlier, some of those bacteria can seed prostate cancers.
Yes.
So what do, you start by cleaning up the mouth, and then hopefully with whatever other treatments you're doing, you can get things under control before it turns into a really problematic disease.
And then we have ways to actually directly treat the prostate. We can inject ozonated oxygen into and around the prostate, which changes this inflammatory response. As soon as you put oxygen, the body can do a lot of healing it can't do without.
Right.
And we can also, for men, we can inject mistletoe into and around the prostate, and mistletoe can kill a cancer.
Very cool.
So the mouth ties in again, doesn't it?
Yes.
I'm Dr. Hal Blatman, Blatman Health and Wellness in Cincinnati and Blatman Integrative Healing in New York City, www.blatmanhealthandwellness.com.
Thank you. Tammy Cole-Schmidt, thermographyny.com.
Have a wonderful day. Hi there, I'm Dr. Hal Blatman with offices in Cincinnati, Ohio and Manhattan, and I'm here today with Tammy Cole-Schmidt.
Hello, I am from Thermography for Health, New York, and Dr. Blatman and I are currently working in the same office.
There we go. And we'd like to talk to you today about breast cancer screening using medical infrared imaging for breast cancer screening, and then also looking at the mouth and the importance of looking at the mouth when you're doing breast cancer screening and considering your risk for breast cancer.
So the biggest thing that I see when we're looking at breasts is we're looking for asymmetries, temperature patterns, things that might be different from one breast to another.
Right. And we're looking at the breast with a heat camera to be able to see temperature changes and also the pattern of the blood vessels through the breast.
Correct. We want those blood vessel patterns to remain stable at all subsequent visits.
And what makes the blood vessel pattern unstable? How do we link that to high risk or low risk for cancer?
Well, the moment the blood vessels change, it's called angiogenesis. And in that instance, that is usually a sign that a tumor is definitely present.
And the blood vessels are changing to be able to deliver more blood supply and nutrition to a developing tumor.
Correct.
So we'll be able to see evidence that a tumor has a high probability of being there by looking at this rather benign test that doesn't involve any radiation, doesn't involve any squeezing or touching, and is a whole lot less uncomfortable than the alternative.
Yes, correct. And from working in the mouth, the thing that I've correlated through the years is that many people who have inflammation in their breasts also have a lot of bacteria in their mouth that we actually test by a microscope. So we can actually see in real time the amount and the types of bacteria that are present.
And you and Dr. Winnick here actually have been doing that microscope work for some time, introduced that to me, and we took that to Cincinnati. So now with our medical infrared imaging and breast cancer screening, we also are looking at the mouth under the microscope. And what are we seeing? What kind of correlation patterns, and what do we do about it?
Well, anytime there are things like spirochetes or short rods, these are all types of bacteria that we know are connected to several diseases in the body. Several types of cancers, as well as Alzheimer's, diabetes, heart disease. So when we see that, we know that there is a bioburden, there is an inflammatory response happening, even if the patient doesn't feel it.
Right.
So what we do is we approach the mouth with something we call periotherapy, which is ozone irrigation, laser treatment, deep scaling and root planing, and then several other adjustments to their home care.
And this actually decreases those biofilms and decreases those bacteria that are in the mouth. And we've been able to see in literature searches of research articles in medicine that the bacteria in the mouth actually seed the breast and increase that risk. So we're actually able to get underneath the hood and mitigate or make that risk lower, especially if we see evidence of a high-risk breast on the infrared imaging study.
Yes, I love that you said under the hood. I like cars. But it's true. There aren't many parts of your body that you can just open up and look into. That's why the mouth is so key to really, if you see inflammation in the mouth, chances are it's moving through the body. And then the beauty of thermography is that you can do the imaging and actually see it.
And you can see the evidence of it, and then you can also study down the road at some point in time and show that you've made the changes you want to make and decrease this person's risk.
Yes.
Very good. I'm Hal Blatman, Blatman Health and Wellness Center, Cincinnati and Manhattan, and
Tammy Cole-Schmidt, Thermography for Health, New York.
www.blatmanhealthandwellness.com and
www.thermographyny.com.
have a wonderful day.
Hi there, I'm Dr. Hal Blatman. I'm here today with
Caitlin Ignatowski.
and we're going to talk today, continuing our discussion about detoxification, today about detox tea.
Here it is.
And this tea, you can make 2 tea bags come in this. You put it into a quart of water, And then you sip it over the next few days. There's a way to dilute it so that you can take it. And what kind of things can people expect as a benefit from this?
This is wonderful to stimulate your digestion and your digestive function,
And also to help with constipation.
constipations, and parasites.
Correct. Parasites don't like this tea and will start to exit your body. Some people have seen some ugly things come out. We haven't verified that by our own eyes, but we do hear tall tales. So if you're interested, this detoxification tea to help you detoxify your body during this month of August and September.
Good morning, everybody. I'm Dr. Hal Blatman, Medical Director at the Blatman Health and Wellness Center, based in Cincinnati, Ohio. And I'm here today with...
I'm Clint Cornell. I'm a physician assistant and health educator with the Next Direct Primary Care Network.
Also
located
in the Cincinnati area.
Yeah.
So we're going to chat today about thyroid. And one of the things that is real important is, how would you know that your thyroid is low? How would you know it's not functioning as well? How would you know that you even need to investigate this question? So what are the main things that people should know about how to find out that their thyroid is low?
Yeah, we see people come in with very vague symptoms. They can include brittle nails, dry hair, brittle hair, thinning hair, fatigue, weird skin rashes, difficulty losing weight, brain fog. Those are a few of the common symptoms that we see.
Agreed. And the things that that really just spark to thyroid, because some of those things on the list could be multitudes of issues, but the ones that really sing to the thyroid song are the fingernails chip and crack, or they're really thin and don't grow, hair gets brittle and starts to fall out, the skin is really dry, and some people say, well, my skin isn't dry. Well, do you put lotion on? Yeah, I put lotion on it every day. Well, why? Well, because it's dry, and especially the bottoms of the feet crack in the wintertime. So if those things are happening to you, your thyroid is low. Well, some people, their doctors tested them for their thyroid, and so their doctors told them they're normal. Let's talk about that controversy for just a few minutes.
Well, Dr. Blatman, one of my favorite things to treat and investigate with patients is this topic of thyroid disruption. And we know that in traditional medicine, when we go through medical school or medical training and residency and so forth, we're taught to look at a couple of lab values, and if the patient's numbers are within a certain range, then we're taught that the thyroid is working the way it's supposed to work. But the thyroid pathway is so much more complicated than just a couple of numbers on a lab test. Most people, if they've had their thyroid checked, have probably heard of a test called a TSH, and that stands for thyroid stimulating hormone. And it comes from the brain when the brain detects that there's not enough thyroid hormone in the blood. And we can get into this a little more this morning, but there's so much more going on with the thyroid pathway that when we just simply look at the TSH lab test, we are really being short-sighted, and we oftentimes miss underlying thyroid pathology.
Right. So when I do a thyroid lab, we already know that your thyroid is low. We're not doing the lab test to see if you're low. We're doing the lab test to make sure it's safe to give you thyroid hormone as an experiment. And basically, anytime your doctor prescribes a medicine for you, he's doing an experiment and you are the lab rat. And what we want to know is, if we do a thyroid test and your thyroid numbers come up really high, then it's not safe to give you thyroid medicine. Something's really wrong, and maybe we need to look down deeper and find out what else is going on, or maybe you even need an endocrinologist. But if your thyroid levels are anywhere close to the normal range, not high, middle range, low, even sometimes high middle range, we'll still give you some thyroid medicine and see what happens to you. And if your fingernails correct, your hair corrects, your skin corrects, it's not dry, you don't have to put lotion on every day anymore. If those things happen to you, then we know that your thyroid level is probably pretty close. And then we do a lab test and make sure that what we've done is safe. In that fashion, we can do responsible thyroid care. And another, piece that people come in with is, my doctor has me on thyroid medicine. And usually it's going to be Synthroid or levothyroxine. They're the same thing. And once you're on thyroid medicine, you think everything is corrected and treated. But even if you're on thyroid medicine, if your hair, skin, and nails aren't right, thyroid medicine isn't working right. And that's more the point. And what we find is that Synthroid doesn't work that well. Sometimes it works fine, numbers are fine, skin, hair, nails are fine, but how many times do you see, Clint, people with taking Synthroid and taking thyroid medicine, and they still have an abnormal thyroid or abnormal thyroid function?
I would bet that more often than not, when a patient comes in and I see that they're on Synthroid or levothyroxine, if I make the bet that their symptoms aren't controlled on that, more often than not, I'm correct. And I think really what you're pointing out is this notion that in medicine we treat patients and symptoms, not numbers on a lab test. People aren't a number on a lab test. They're individuals with symptoms and physical exam findings and histories. And part of thyroid treatment, probably the majority of thyroid treatment, is digging into those symptoms. And as we were talking, one of the main symptoms we often see with thyroid is this idea of cold intolerance. People who are always just a little cold, they can't get warm enough. That's another one that comes to mind. But when we talk about medication, I think it's helpful to understand that the thyroid hormone really comes in several different forms. There's an inactive form that the thyroid produces. We call that T4. And it's this T4 or inactive thyroid that is the medication form. That's the levothyroxine or Synthroid. The body has to take that inactive form of thyroid and convert it to something called T3, which is the active form. It's the T3 that binds with the receptor and does the work, so to speak. And so if you aren't able to convert the T4, the inactive form, to an active form, well, your blood levels might look okay, but your symptoms aren't going to improve.
Exactly right. And so you walk around with a blood level that's relatively normal. Your doctor looks at it and says, well, your thyroid is normal. And you look at him and go, well, my skin isn't right, my nails aren't right, my hair isn't right. What is the deal? Yeah. And so we, long time ago, got into a very good habit of treating the person rather than treating the lab test. And there's other things that can throw that lab test off. Like one of the things we test often is thyroid antibodies. Yeah. You can have high levels of thyroid hormone and your immune system is taking it out of circulation and not letting it do its job. So the numbers have all kinds of reasons to not be effective. And you can't measure thyroid function by just measuring blood levels, because that doesn't tell you the whole story of what's going on. And then you mentioned temperature. Let's talk about that for a minute. That's not something you can always just correct by taking Synthroid or taking thyroid medicine, but how many people do you see whose normal so-called body temperature is 97? And weren't we taught that normal is 98.6? Can you address that?
Yeah, there's a high proportion of people who come in, and we'll catch this when we do their vital signs in the office. You'll measure a temperature and they're 96.8 or 97.4, or whatever the number might be, but it's consistently lower than that normal temperature that we're taught to look for. And one of the old-fashioned ways of diagnosing an underactive thyroid is actually to have a patient measure their basal body temperature over a period of days and track that. And we still use that technique today. So temperature is a very critical part of evaluating the thyroid.
But temperature doesn't always come up when you're taking thyroid medicine. A lot of people with normal functioning thyroid medicine, hair, skin, nails, and so forth, and their temperature is still 97. And so what we say to these people is that 97 is never normal. It might be what you run at, but you're supposed to run at 98.6. And the reason for that is that most everything in our body happens by chemical reactions of one form or another. And if these chemical reactions were left on their own to go at their own pace, everything would happen really slowly in our body. So if our temperature is below 98.6, all the chemical reactions in our body happen slower. And the chemical reactions in our body don't happen at their own pace. They're all catalyzed by something we call enzymes. And enzymes are often vitamins that we take. And these enzymes allow chemical reactions to happen very, very quickly. But all these enzymes in our body have an optimum operating temperature, which happens to be 98.6. So if your body is running at 97, that means all of the chemical reactions in your body, including the ones that help you heal, are all running slower. So if your body's running slower and your metabolism is a little slower and you'd like to speed that up, one of the things you can do is look up Wilson's syndrome. Look it up online. Do you know much about that, Clint?
You know, Dr. Blatman, I'm familiar with it, but I'll let you elaborate more.
So Wilson's syndrome, you can look that up online, and you can download or buy and purchase the physician manual of how to treat it and the patient manual of how to treat it. And I would suggest you get the patient manual and look through that, because that will tell you what correcting this is going to take. And it usually takes a few months of cycling T3, low doses, and then raising the dose, and then bring the dose back down again, all with the purpose of correcting your body temperature and getting it back up to 98.6. We've done this a few times. It's not a comfortable process. It's not a particularly uncomfortable process. It does take a few months, and you can reset your body temperature back up to 98.6 if you're tired of running at 97 and you're willing to go through the 3 months of what it takes to reset that. All right, let's talk about some of the brilliance. Why the brilliance of the biologic design of T3 and T4. You mentioned that T4 is produced by the thyroid gland, and then the body has to convert that to T3. Well, the brilliance of that is that if the body's thyroid gland, which is right here in your neck, put out active thyroid, then all of the body parts close to here would get a lot of it, and all the body parts far away, like your fingers and your toes, they would get it last, and there might not even be any by the time the thyroid hormone gets to them, right? So the thyroid T4 gets secreted by your thyroid, circulates all over your body, and your body converts it when it gets to where it needs to be. So everything in your body gets thyroid at the same time and gets enough of it, because it converts in your big toe the same rate it converts in your fingers, converts close to your thyroid. So distance from thyroid doesn't make any difference. And that's one of the brilliant things in design about why and how the body does that. What do you most often prescribe? We've just spoken about how Synthroid doesn't work. Levothyroxine in many people just doesn't work. So what do you use instead?
Well, you know, when you brought up the Wilson's protocol, one of the reasons that I defer that over to you, I haven't used it in a long time, because it's a very difficult protocol, and it's hard on the patient, and it's a lot of work. And so we find that it's not very many folks who are willing to or able to go through that successfully. But if you have the right patient and they're motivated, you're right, that can be very effective. What we tend to look at in terms of treatment, especially our medication options is a product that has um, an amount of the T4, the inactive thyroid hormone, but also one that contains the active thyroid hormone, the T3. And our preference is something called Armour Thyroid. And actually, this was a little tidbit that I picked up hanging out with you, is because the Armour Thyroid comes from a pig source, you get that messenger RNA that, every once in a while it might help rejuvenate the thyroid gland. So I found that was very interesting. We always went with Armour as a first-line therapy because it had both inactive and active thyroid hormone, but that messenger RNA tidbit, I think, just reinforced that choice even more.
How do you know you're getting too much thyroid?
Well, again, we go back to symptoms. So if someone's starting to feel like they have tremors or shakes, or they're anxious, or their heart rate is too high, if they're feeling excessively warm, hot, those are signs that your thyroid level is too high, and we'll back off.
Agreed.
Yeah.
Agreed. And so when we give people their first doses of thyroid, we're really doing an experiment. And the person is essentially the lab test. And so if your thyroid levels are right, your hair, skin, and nails correct. If your thyroid levels are too high, then you get an uncomfortable beating in your chest. Your heart goes a little too fast. It's not dangerous. It's not something to worry about, but it's not comfortable. And as soon as you stop and bring your thyroid levels back down, it goes away just in a few hours and you don't use that dose again. I rarely see that happen, but that's your safeguard. So that's how you can tell if your thyroid is too high. If it's too low, you're looking at your hair, skin, and nails. If you're taking thyroid medicine and you're still putting lotion on the bottoms of your feet and your heels are still cracking, your thyroid isn't up to snuff, and the medicine you're taking isn't working really well. And then there are some people, just like we were just talking about, who come in and tell me, doc, I haven't seen you in a while, and I need to let you know about this thyroid thing. About 6 months ago, I started to feel those palpitations in my chest, so I lowered my dose, and it went away just like you said it would. And 2 months later, it came back, and I lowered my dose again. Well, I got to tell you, I haven't taken any thyroid medicine in the last 2 months, and my hair, skin, and nails are just fine. And that's what we're talking about. The messenger RNA in the pig parts that are included in the T3, T4 preparation actually helps your thyroid gland rejuvenate itself and take back over again. So that never happens with levothyroxine, but I've seen it happen a number of times with these other preparations. And there's a few, there's more than just Armour Thyroid, and they're all made basically the same way. Some of them are dairy-free, some of them are gluten-free, not all of them are everything. It depends on the fillers and how it's all put together. But you can look at and research the particulars of that. Another thing I'd like to discuss before we quit is, how often do you take the medicine? Like, there are so many people who come in and they're taking Armour Thyroid or one of the others, and they're taking it once a day. And I really need to let everybody know, this is not a once-a-day drug. This is a twice-a-day drug. And your dose should be even. What you're trying to avoid is a big peak blood level, a high peak from a dose that was taken once a day, and then you're without it when that goes away for the whole rest of the 24-hour cycle. So it should be at least taken twice a day. And if your dose is getting higher than that, you don't take 2 in the morning and 1 at night, or 1 in the morning and 2 at night. If you can't take 1.5 morning and evening, then you take 1 about every 8 hours and divide that up. And you try to even it out as much as you can. And then we have 2 more questions. One is, do you have to take it the same time every day? And do you always have to take it on an empty stomach? Because we hear both of those things a lot with thyroid preparation. What do you tell your folks?
So we tell them to try to take it as consistently as they can. And we also tell them to try to take it on an empty stomach, at least 2 hours fasting.
All right, and that's what a lot of folks say. But I have a more practical approach to it. I take my first one in the morning on an empty stomach, and I do that every morning. But I don't wake up every day at the same time because, I might take my weekday when I'm going to the office at 6 o'clock in the morning. I'm not waking up that early on Saturday and Sunday unless there's something that I need to wake up for. So if I wake up at 8 or 9 o'clock, that's when I'm going to take my thyroid on an empty stomach. And then my next one, because I'm on a 3 times a day schedule, my next one is about 8 hours later, and sometimes I remember, and sometimes I don't. And when I don't remember, then instead of 2 o'clock in the afternoon, it turns out to be 6 o'clock at night as I'm leaving my office, and I go, I forgot my thyroid today. I'll go take my second dose now. Well, it's not exactly at the 8 hours, but here's the point. Do you think the little man in your thyroid gland, who gets the message from up here that he's supposed to release the thyroid, do you think he ever looks at his watch and goes, wait on it, not yet, go? It doesn't do that. So we know that the thyroid gland pulses. We know that it secretes into bloodstream, but we don't know what makes it trigger to pulse now versus an hour from now. So as long as you get the dose in that your body needs for the day, your body can figure out the little things that are in between and different. And it's okay to miss by an hour or miss by 2 hours or even miss by 3, because what you're really trying to avoid is taking 2 of them at the same time and having a peak blood level that shuts down your biofeedback mechanisms that you need. So you don't overpower your biology. And that's why you divide it and do it in divided doses. Yeah, you can make it for a while taking it once a day, but usually in about a year, sometimes 2 years, sometimes even way sooner, depending on how big that dose is, your thyroid is not going to work. And here you are taking the medicine, your blood levels are maybe sky high because now it depends when you test, and you still have thyroid symptoms because that once a day doesn't correct you. So let's talk about empty stomach versus full stomach, and then let's talk about when to test. So I take the first one on an empty stomach because that's first thing in the morning. But my other ones, not necessarily so. And if you forget to take the one before dinner, then take it after dinner because you still need it. And your body, it will absorb more slowly. You might not absorb quite as much, but you're still getting it into your body, and your body will figure out some of the differences. And it's not worth making you crazy to make sure you go 2 hours before, 1 hour after, whatever that number is. That's enough to make you goofy during the daytime. So I try to tell people, you'll know you're doing right by your hair, skin, and nails. And as long as you're close enough and have good enough thyroid, your body will give you the right answers. So one more, let's talk about when to test. So you're at your doctor's office and your doctor says, let's test your thyroid. Is that ever the right answer? And I'm going to tell you no. So when do you send your patients for test?
So we usually test first thing in the morning, and after a fast of at least.
Well, we don't do it that way. We do the test midway between doses. If you're supposed to be taking it 3 times a day, that's roughly 8 hours, then we want to test you 4 hours after your empty stomach dose. If you're taking it every 12 hours or supposed to be taking it twice a day, then we want to test you at 6 hours after your morning dose. If you test in the morning before your dose, your levels are going to be really low because your last pill was 12 hours ago. If you test right after your morning dose, your levels are going to be sky high. So that's not the right answer either. You want to know where you are midway through the day. You don't want the peak. You don't want the trough. You want to know where you are in the middle. And that is midway between your doses. If you're taking it every 8 hours, it's at 4. If you're taking it every 12 hours, it's at 6. That gives you a level that you can understand. And if you are taking my thyroid medicine and your family doctor orders a thyroid test and you do it 2 hours after you take your thyroid medicine, your levels are going to be really too high, and your doctor isn't going to give you the right answer. He's going to lower your medicine. And that's not the right answer either. So those are the things that are critical. Don't take it all at once, and make sure your lab test is timed. All right.
Okay, Dr. Blatman, if you could pick a number between 1 and 3, we're going to be awarding someone lifted infused tea samplers.
Let's pick 3.
Sylvia, congratulations. This is Taslima. She's the creator of Lifted Teas, and you can find her products at symbol Lifted LFTD Infused Tea, and that's on Instagram and Facebook. So Sylvia, you're the winner today. Is she there?
She's here. She's muted. Let me see. I can unmute her. Does all this have an effect on your liver and your white blood cells being low? I don't know. I've not heard an effect on liver and white blood cells being low. I'd be looking for something other than thyroid. Have you seen thyroid issues? Low thyroid affecting white blood cells and liver?
No, there's no correlation that I'm aware of. Thyroid really is so much to do about metabolic rate and energy production in the cell. Not much correlation with white blood cell count.
But Sylvia, your issues of dry, itchy skin, cold off and on, and fatigue could certainly be related to thyroid, and once a day is not the right answer. And so now you can correct that. So take it twice a day, and if you need a bigger dose, then if you can't split it in half, then you take it 3 times a day. All right. Well, I'm really glad we did thyroid.
Okay.
That's all.
Sylvia, you may reach out to me at Dr. Tranquility, Lydia on Instagram, or Taz directly at Lifted Teas, and you will get your sampler at Lifted LFTD Infused Tea, and we will make sure you get your sampler. Okay.
Right. Well, thanks, everybody. Have a wonderful day. We'll pick a topic for next week, and we'll see you next Saturday morning. Bye now.
I'd like to discuss for a couple minutes why carpal tunnel syndrome happens. We were taught when we went to medical school, and with a predominant view today, is that when you do a lot of this kind of motion with your fingers, the tendons that go through your wrist canal or carpal canal have to move. They get inflamed from all that activity, and that pushes on a nerve that runs right behind this ligament that connects these 2 sides of your wrist. And the surgery is to make an incision through this wrist and then through that ligament, let that ligament separate, sew up the skin, and let you go home and figure it out. That relieves pressure of the structures that go through this canal. And if we send the cover of those tendons off to the pathology lab, there's no evidence of that supposed inflammation. So maybe that theory doesn't hold any wash. There's 2 others that I'd like to talk about. One is, in order for your fingers to do this really fast, you have to hold your wrist really still. And to hold your wrist really still, that requires a sustained contraction of your biceps muscle. And while the biceps muscle ends here at your elbow, the fascia that goes through this muscle and holds it together continues all the way to your palm and fingertips. And as this muscle stays contracted, the fascia tightens. And then the fascia in your forearm tightens. And then this ligament actually tightens, and the canal through your wrist gets smaller. So it's not that the structures inside the canal swell up, it's that the canal actually shrinks. And the articles that describe that were written in the osteopathic literature back in the mid-1990s, and they talk about a set of stretching exercises that we teach still today, where you stretch the forearm biceps, you stretch the forearm, that we still teach today, where you stretch the biceps, the forearm, the transverse carpal ligament, and there's a set of stretching exercises that we describe in my book, Winner's Guide to Pain Relief, that talks about how to relieve your symptoms of carpal tunnel syndrome, thinking that the cause is from all of this fascia tightening and this shrinking. The cause is all of this fascia tightening and the canal actually shrinking. And in actuality, the case reports show that not only do carpal tunnel symptoms get better, but a positive EMG test, which was the gold standard and still is considered the gold standard for carpal tunnel screening, that test can go from positive to negative just with this set of stretches. We've described them very well in my book. Another theory for carpal tunnel syndrome is that many of us through our lifetimes have used our hand as a hammer. Hand's not meant to be used as a hammer, and that causes injury to the carpal canal, especially adhesions or stickiness between the ligament that covers and the nerve that goes right behind it. And if there's any adhesions or stickiness, when you open and close your fingers, the tendons obviously have to move, but the nerve has to move through this canal also, because the nerves go all the way to the fingertips. And if the nerve is stuck on the back of that ligament, when you open and close your hand, it doesn't move well. And if you tug on a nerve every time you open and close your hand, that nerve gets very unhappy and you get the symptoms of carpal tunnel syndrome. The fix for that is we do a needle surgery and hydrodissect. That means we put a needle through here and use fluid to separate the nerve from the ligament so that it can flow freely in this canal. No incision, no sutures, very uncomplicated recovery afterwards. 30% of the cases that we've done have required a second procedure, but we have 90% good results and 0 bad results. Whereas if you go for carpal tunnel surgery with the traditional incision across your wrist, that has 50% good results, 50% not good results, and 30% of them can be disastrous results where you have chronic issues, perhaps for the rest of your life. There are different ways to handle carpal tunnel syndrome. We hope we've helped you. This is our IV therapy room. We do various different IV nutrients and various intravenous treatments to help people recover from Lyme disease, help people recover from chronic fatigue, and many other issues. Do you know a musician who is suffering from pain that could end their career? Perhaps their situation has become such that they are now trying to avoid surgery that could also be career-ending. Finger pain from joints and muscles, cramps in forearms, neck and shoulder pain, headaches, wrist pain and arthritis, drummers with shoulder pain, thigh and calf pain and cramping. At the Blatman Health and Wellness Center, we have experience in treating musician injuries and pain, saving careers of instrumentalists playing strings, keyboard, percussion, and more. If you know a musician who needs help to continue in the life they love, share this post and help them get the help they need.
Our next speaker is a nationally recognized specialist in treating myofascial pain. He's board certified in integrative and holistic medicine on the topic of exosomes and chronic myofascial pain, rebooting the body's self-healing mechanism. My great pleasure to introduce to you Dr. Hal Blatman. Welcome.
Good morning. Thank you, Alex. And welcome everyone else. Dr. Hal Blatman, Medical Director of the Blatman Health and Wellness Center in Cincinnati, Ohio is our base. I have an office in Manhattan and also in Seattle. I'm going to go and share screen. Share. Slide. There we go. I'm going to speak today about exosomes, chronic myofascial pain, rebooting the body's self-healing mechanisms, and specifically talk a little bit about where does lower back pain come from, how to make it go away, and show you some exciting things we've learned about scoliosis. Exosomes are tiny vesicles full of growth stimulators and growth factors given off by stressed out stem cells. They're harvested from stem cells and they can be used to help heal, repair, and grow new tissue. You can apply them topically, you can inject them into fascia, into joints, and you can use them intravenously and also into spinal cord. Let's talk what is chronic pain. Everyone agrees that it starts with an acute injury, but the world is taught after that acute injury causes acute pain, that if that pain stays longer than 3 to 6 months, it magically transitions to chronic pain, in which case we have no hope to make it go away. And what we have to do is stop the signal. So we kill the nerves, we use epidural steroids, we make the nervous system not work using various medications and TENS units. Fortunately, that's not the way our biology really works. It's just the way medical doctors were taught. Our reality is that acute pain does come from an injury. But the reality is that our body will continue, or our brain will continue to experience some evolution of that pain until we heal from the injury that caused it. And it doesn't matter how many years it is, doesn't matter how long we've had it, doesn't matter what part of our body it's in, most chronic pain can be made to go away. There's almost no such thing as intractable pain. Granted, it happens. There are people who suffer. This doesn't work 100% of the time. But there's so many people who suffer that don't need to, believing that their pain can't go away. And when you heal those injuries, you can make most of this pain go away. So, where does pain come from then? How do you figure it out? And then how do you make it go away? Well, you learn from this seminar and all these wonderful speakers that a lot of medicine is not what we were taught. Well, indeed, most of pain is also not what we were taught. So, I've coined 5 rules of how do you figure out where your pain comes from. Rule number 1, you can't believe the pain comes from where you feel it. Your headache does not come from your head, not from your blood vessels, not from your nerves, not the way we were taught to believe. Your knee pain doesn't come from your knee. Just ask the people that you know who've had their knee replaced, and how many of them does their knee still hurt? And the pain in your left arm could be your heart attack. You don't really know. Rule number 2, you can't believe what you think the pain feels like. We were taught to really ask questions about where does it burn, where does it tingle, where does it ache, all those varying nuances of how you perceive the pain. And truth be told, it doesn't really matter. None of those differences are diagnostic. Burning doesn't necessarily mean anything different than aching or stabbing. It all comes from the same stuff, or most of it does. It's not diagnostic. The location of where you feel the symptoms is incredibly important, but what they feel like is a backseat. Rule number 3, what can you believe? What you can believe is where your fascia is tied in a knot, where those ropey bands of muscle are really tender. Those are the kinks in your fascia that generate a lot of this pain. And then if you trace that rope out to where it ends and attaches and links to your skeleton, you'll feel the injury of how did it happen. Rule number 4, the places as we examine you together, you and I, where you're most specifically tender, represent the injuries through your lifetime that cause most of the pain that you came to see me for. And rule number 5, about 90% of the time, as quickly as we can unkink the fascia that holds you together, and as quickly as we can reinforce and help you heal the injuries that happened through your lifetime, the pain you thought you had will go away. And so often, it's not a whole lot more complicated than that, with the exception of, as everyone else has said this morning, your food needs to change. So, fascia has many forms. It can be sheets, it can be strings, it can be a ligament, it can be the cover over your brain. And Tom Myers discovered by fascia-sparing dissection that it occurs in lines through the body. You can trace it from one place to the next. Here is the superficial back line of human fascia. Take a look at this video. It starts looking at the toe or the plantar fascia where foot pain may come from, the heel, the gastroc tendons, the gastroc muscles, the heel cord. Look where the hamstring and the gastrocs attach. They only tack into the back of your leg. They really attach to each other. If your hamstrings are attached, you're coordinated differently than if they're separate. So how you're put together depends on what you can do with your body, or helps determine it. This is the lumbar fascia coming up to the muscles that go up your spine, and shortly you're going to see here is your neck, and then the yellow on the top is the galea that goes up over your head all the way to your forehead, You are one string, goes down from your forehead all the way down to underneath the balls of your feet. In a similar fashion, you have deep and shallow lines up the front, up the sides, spiral lines across your middle. We'll talk about that in a few minutes when we talk about scoliosis. So, in order to illustrate the point, let's feel your neck. There's a muscle right here where this green arrow is, blue arrow. Right here. You can put your hands on that. You can feel that it's really tight. You can feel a rope through that muscle. And you can feel at different places it has different levels of tenderness. That texture is what you need to know to be able to touch someone and tell them where their pain is by what they feel like in your exam. And then feel down here, right on the top of your collarbone, where this muscle attaches. And there'll be some places that are really tender. That's the injury that causes this knot. How did you get it? Maybe you were in nursery school and you walked in the morning and Sally, you just irked her just by walking in because your lunchbox was the same color as hers. And she came up behind you right before morning recess and pushed the back of your shoulder blades and tore this muscle, and you wear it in this knot, which may be causing you migraine headaches for the rest of your life. You grasp and pinch the muscle just like that. You feel it just like this, and you can feel those ropes and knots too. And if you hold on to them a little longer, you'll feel the pain go right to your eye. And when you let go, you'll find your neck moves better and your head moves better, and you've just learned how to help make this go away. And so the X's represent the kinks. The red speckles are where you have the pain pattern, however you perceive it. And here's one end of the injury, here's the other end of the injury. So, if we look at lower back pain, we're taught that our pain comes from these nerves. We're taught that we injure this disc. Well, how many people do you know have had that surgery and are better or still hurt? So, if we look at these treasure maps, where is the kink? Where does the pain come from? These are by Janet Travell and David Simons. Here are the ones for lower back pain. Most of the pain that you think is in your lower back comes from this tender area in your glutes. And where are the injuries? You can feel to where the rope ends on the top part and the bottom part. Those are the injuries where you're most tender from this lower back pain. And the fascia strings go all the way down your leg, and that's most of the reason for the transmission of the pain. And the thing you felt give wasn't your disc, wasn't your lower back. It was the tendons that hold your butt together. And where did you first injure them? When you were a child, jumping out of trees, jumping down the steps. And you were the kid that led the other kids, followed the other kids, or watched the other kids jump off the roof. So, for treatment, you make these kinks and trigger points go away. You restore and strengthen how you anchor and hold together. And then you also need to reduce the food and toxicology-based inflammatory pain. So we, on our website, www.blatmanhealthandwellness.com, have a do not eat list that you can get by signing up. That do not eat list gives you the inflammatory food list for your biology. I don't believe there's one diet that's appropriate for anybody. We're all a little bit different. But I do strongly believe there's a do not eat list for our species. We need to stay away from poison or things that aren't good for our biology. So, you know that this is tender because of an injury. You now know some understanding of the tenderness by your hips and what that means from jumping off the roof. But your body has no idea that it didn't heal you when you did that and created those injuries. And we've injured these areas many, many times in our lifetime. This wasn't just from nursery school. This was from a car accident and from standing on your head and from the cheerleading accidents and God knows what else. And every time you injure, your body runs a repair program to fix you, but at the end of the day, your body's done an incomplete job and it has no idea. So to turn on your healing program, we have to re-injure you. We do that by poking you discreetly with a needle. And then we need to put magic into the needle so your body heals faster and stronger than it could on its own. Well, if you remember, you skin your knee, you bleed, you make a scab, and 4 weeks later, The scab falls off and you have new skin. Well, this isn't any different. We take blood out of your arm, concentrate the parts that would make that scab, add exosomes, maybe add stem cells, put that into these areas as we create this wound. And in 4 weeks, 8 weeks, and 12 weeks, as the scab falls out and as your tissue becomes stronger because of what we put in, you heal and you grow a new tendon, whether it's for your hip, whether it's for your rotator cuff. You don't really need to have the surgeries we were taught that we needed to do. So here's an example. This woman has head and neck pain, bad hip and lower back pain, and her weaknesses are where her tendons hook up and where her fascia hooks up for her thigh, for her glutes, for her neck. And so on one day we go and we do a needle surgery to repair all these areas, and a month later, look how much better she is. And 2 months later, even better than that. You are not destined to have pain just because you have old injuries that you don't know how to find and your body doesn't know how to repair. Let's talk about scoliosis. Scoliosis occurs, in my belief and my understanding, when the fascia strings that you just saw evidence of by that dissection video, the child grows and the fascia strings either don't grow fast enough or they contract pathologically, pretty much like Dupuytren's contracture when it closes the hand. And when that happens, the patient or the child can't grow vertically, so they grow in the path of least resistance, which is not an S-curve, it's a spiral. It looks like an S-curve because it's a two-dimensional X-ray, but there's a rib deformity that goes with this, and the spinal bones get deformed by the time you're 17 years old. So if we're going to help you reverse it, we need to do it while you're a lot younger. And the reason surgeries are done and rods are put into children is so that their spine doesn't become so deformed that it compromises their lung function and they can't breathe. So, this is a child. He was 13 years old. He was noted to have scoliosis by the school nurse, confirmed by the family doctor. No forward-up plans were given. 6 months later, just about a year ago, the son told the mother that the ribs were sticking out. She didn't pay attention. And last December, the school nurse noted scoliosis again, and this time the orthopedic surgeon took an x-ray, and the x-ray showed this curve that you see on the left-hand side. The father knew me, sent mom and child on an airplane to visit us, and we released the fascia that binds the child, and his second x-ray is a whole lot different. The curves changed on the top from 43 to 35, and on the bottom from 45 to 28. We're fascinated by this. It's preliminary, but it gives us a different understanding of how do we change scoliosis and prevent the surgeries that traumatize so many children. So, exosomes and stem cells can also be administered intravenously. You can accelerate healing from surgery. You can rejuvenate your body. There's all kinds of hope for many different chronic diseases. Here's arthritis. So this is a year stem cell injections into the knee. Not my data, but data presented at a conference. This is how much growth happened in a year from one injection of stem cells into the joint for this patient. Also, the immune system can be changed. You can help settle down the immune system in rheumatoid arthritis. These are the after pictures. This woman had rheumatoid arthritis for 10 years before we saw her. Her knuckles are a whole lot less swollen than they used to be. She can wear gloves she hasn't been able to wear in years. I wrote a book several years ago to help teach these concepts to people, to teach you that your pain comes from fascia, and to teach you what you can do about it. The book is called Winner's Guide to Pain Relief, available on our website, www.blatmanhealthandwellness.com. It gives you a self-help book where you can learn how to take a rubber ball, find these knots and kinks in your fascia, and massage them out yourself. And when you look on our website, not only can you order the book, but you can sign up for our community talks. Saturday morning at 9:30, I'm going to go through topics in a similar fashion to this and help teach you more about your body. Here's pictures from the book showing you how to use that rubber ball on that muscle, that knot in your butt that I showed you on a previous slide. You rub that knot out well enough, you can help make a lot of that pain go away. Unkink the knots, smooth out the fascia. And then learn how to unglue the fascia, learn how to repair the fascia so it doesn't come back. So, headache, lower back pain, pelvic pain. Pelvic pain isn't any different. Everybody thinks it's the pudendal nerve and pudendal neuralgia and psychosocial emotional trauma, which certainly is part of the deal. But you have fascia injuries that need to be repaired. They can be found, they can be repaired. Pelvic pain is pretty much a migraine. Instead of it being in your head, it's in your pelvis. Like lower back pain can be a migraine in your lower back. All these pains are caused so much by the same thing. And then to give you insight into scoliosis, what really causes it and what are the possibilities to help a child grow up without that curve. Want more information? We have a newsletter that comes out you can sign up for, www.blatmanhealthandwellness.com. I'm also present in New York. Our office once a month is 321A West 24th Street, on the west side, 8th and 24th. I also have a presence in Seattle where I'm part of the faculty at Bastyr University, a naturopathic four-year medical school. You can reach us at 844-282-8900. Thank you very much. I have some time perhaps for questions.
Great presentation, Dr. Blatman. Thank you so much. Anyone has specific questions? We have a minute or so here. But you've seen people resolve problems that they couldn't resolve before: back pain, elbow, tennis elbow, neck pain,
all of these things. And we do this for weekend warriors. We do it for the young. We do it for the old. We see children in the office, and we have a lot of experience with professional athletes. Things that have a lot of difficulty healing. You need to get back on the field to play. College athletes, high school athletes. There's so much we can do to accelerate healing and get ourselves back in the game.
Michael wanted to know, to what degree is moderate scoliosis reversible to normal?
Once your spine has deformed, your spine bones actually will start to look like a double trapezoid deformity, like a spiral staircase. Once that happens, it's really hard to undo. If we get you before that happens, possibilities are pretty strong. So we like to see you between 11 and 14 years of age. We can always help with the pain, can always help with the discomfort. Even if you're 40, 50, and 60 years old, it's rare that our work won't be helpful.
Very great. Well, thank you so much, Dr. Blatman. I appreciate your unique approach and your passion for your work. We appreciate you being here. Thank you.
Thanks, Alex, and thanks everyone for being to listen.
Great.
Inside the heart of every molecule air purifier is a unique process called PICO, or photo-electrochemical oxidation. While the HEPA filter captures 99.97% of small particles, a layer of carbon reduces gases and odors, and PICO destroys organic pollutants. As UVA light photons strike the proprietary nanocatalyst, hydroxyl and other radicals are created on the surface of the filter from water vapor. These highly unstable molecules exist only for a moment on the filter surface before rebalancing with the air. As pollutants pass over the filter, the hydroxyl and other radicals on the filter surface react and break them apart into natural, harmless elements like water and carbon dioxide. Finally, new radicals are created, ready for the next pollutant. Molecule, beyond filtration, scientifically clean air.
Hello friend, Henry Flowers here. I've been an avid tennis player for about 8 years, and I remember the night when I had flaming, excruciating pain in my tennis arm, and I ran over to Dr. Hal Blatman's court. See, he had spoken to me a couple of days before about the treatment that I needed to fix my arm, and wasn't really interested in it then. But when that pain flared up on my arm, that pain said, Henry, you're not playing tennis again. And I ran over to Dr. Hal's court and I said, hey, when can we get an appointment? Went into his office, did the treatment. the the treatment wasn't covered under my insurance, and I didn't care, because in a very short amount of time, the treatment turned into transformation. And with the work that he showed me how to do, how to work the tendons, just real simple stuff that I did at home, I was back on the tennis court in a very short amount of time. 2 days. It transformed my life. I highly recommend Dr. Hal. You do not have to live with pain. I'm proof positive. I'm playing tennis longer and stronger than I ever have before. Tennis elbow is no longer my enemy. Thank you, Dr. Hal. I recommend Dr. Hal. Go see him. Get it done today.
Hi there. My name is Hal Blatman. I'm a medical physician and medical director of the Blatman Health and Wellness Center. And I'm here with TJ Lonergan.
And I'm clinic director for Impact Health and Spine Centers. I'm a chiropractor.
And we're going to talk today about neuropathy. And the first part we're going to talk about is, what is neuropathy?
So most people don't know what neuropathy means. They just something they get, a term they hear at a doctor's office, and then you go home, you try to Google it, and you wonder, what the heck is this?
Right. And neuropathy has to do with damage to your nerves. And we usually talk about peripheral neuropathy because central neuropathy happens in your brain, and peripheral is everything outside of that. And mostly it affects hands and feet, fingers and toes. And the symptoms would be what?
Well, from the word neuropathy, the pathy means pathos, something wrong. And so something's not right. It's an altered sensation. And that can be anything from your feet are cold, but then you touch them and they're warm.
Right.
Or your feet are warm, but they feel cold.
Right.
Or you think you're walking on rocks.
Yeah, or pins and needles.
Pins and needles.
Numbness.
You feel like your feet are wood, blocks of wood you're carrying
around. So your
around.
nerves are not working, and they're not working the way they should. And so your sensation is altered anywhere from numbness to pain.
Yeah.
All of that can happen. And why does it affect mostly your fingers and your toes before it affects other pieces?
Well, because in those areas, the nerve endings are very sensitive because we're out there finding the world.
And those are the tiny nerve endings supplied their nutrition by the tiny blood vessels. And the injuries to these areas happen first and more severely than the ones to the bigger nerves in our more central nervous system. And what kinds of things cause those injuries?
Well, for a lot of people, it can be diabetes. About 70% of diabetics will get a peripheral diabetic neuropathy. Chemotherapy is a big one because it affects how the nutrition and the health of those little sensory nerves, those little sensitive nerves, is managed and maintained. And then anything else that affects this nerve itself being able to signal from the brain all the way down to the toe, anywhere along the line, there can be problems that can add to this.
And these injuries can either be a direct injury by a drug that causes injury to the nerve, or it can be a lack of blood supply, like in diabetes, extra what we call oxidative stress that damages all kinds of parts of our body, and the nerves don't survive so well, and they sustain this kind of injury.
And then you get those little electrical shorts in the system, and you start getting either misinformation or no information.
Right.
And you start getting, in the end game, death of the tissue.
And people think especially of peripheral neuropathy, but I think we want to make the point that it doesn't happen in isolation just in the periphery. You've got tiny nerves in your heart, tiny nerves all through your body that also get injured at the same time. You only notice it in your fingers and your toes because you touch things. If your heart could touch things and you would feel that, you'd think much differently about this whole concept. So
you're saying the Tin Man who doesn't have a heart wouldn't feel this?
He might not feel it at all. That's exactly right. And don't think that the injuries to your fingers and your toes are happening in isolation, just in your fingers and toes. This injury from chemotherapy and diabetes is all over your body.
Because, the diabetes is having to do with the blood, and the blood's everywhere. The chemotherapy is put into your blood, in which it's going everywhere.
And oxidative stress from those is everywhere.
And when you have your fingers and toes being the furthest thing away from home,
right,
way out there, like kids away at college, that's where
you can't watch over them.
can't watch them over every second.
That's
You know,
right.
and you got to make sure everything's happening. You know, that the proper exchange of nutrients is happening. That all the groceries are getting in the house, and all the garbage is getting out of the house.
So hopefully, this little interchange will help you understand what is a neuropathy and how do you get it. I'm Hal Blatman of the Blatman Health and Wellness Center, here today with
TJ Lonergan with Impact Health and Spine Centers.
And you have a wonderful day. Orthopedic textbooks tell us that we cannot grow cartilage in worn-out knees. Look at the wear and tear in the right knee and left knee, and look how much cartilage has been restored using peptides, glucosamine, diet changes, PRP, and stem cells. You can regrow cartilage in worn-out knees.
Hello, I'm Dr. TJ Lonergan with Impact Health and Spine Centers, and I'm sitting here with Dr.
Hal Blatman, Medical Director of the Blatman Health and Wellness Center. And today we're going to talk about, let's say you have a neuropathy. Your fingers are in trouble, your toes are in trouble. What do you do? Is there a way to recover? Are you destined to have that pain, discomfort, numbness, walking on coals for the rest of your life?
You got options. That's a big thing for us to be able to explain to you, is that there's a lot you can do. And we talked a little bit earlier in a prior video about what you can do nutritionally for yourself. There's a lot of options at the grocery store, you know, but beyond that, you want to get more specific, you know, there's more that can be done out there in the healthcare community. And one thing in particular that most people don't know about and they've heard a little bit about is stem cells, Hal.
Stem cells are a very new and an important treatment. If you inject them into the body, they will go to where your body is setting up signal flares where it needs help. And they can latch onto blood vessels nearby and secrete all kinds of growth factors and signals to help your body recover from injury. And there is potential to use that for neuropathy.
And getting that nutrition back into that nerve, that sensitive nerve that's being affected, and that's the reason why you're getting all these altered sensations and it's affecting how you live your life. You know, beyond just those stem cells, you can also use some supplementation. Talk to us about some specific things in supplementation that really help out.
Nutritional supplements are the ones that we've used for diabetes and diabetic neuropathy for years. They're N-acetylcysteine and alpha-lipoic acid are two of the really big agents that you can use. There's also herbal medicines that can be done. And one of the most fascinating things that helps put energy of healing into the body is infrared light. All kinds of so-called cold laser devices and infrared light devices can help the nervous system recover from an injury.
And when you think of these kind of infrared lights and low-level laser therapy or cold laser therapy, you know, what you're really talking about is these have wavelengths and properties. That's why it's a red light or an infrared. It's on the spectrum. And so these wavelengths and these frequencies signal, again, send up these signal flares you're talking about, like with stem cells.
Right.
Is they stimulate the body to kind of heal itself, right?
And they put energy in the body that the body can use for these healing purposes. And then it's important to eat clean, eat well. We eat for two reasons. We might think we eat because we're hungry. We might think we eat because it tastes good. But that governs what we eat and when. The reason why we eat is two. One is to get fuel to burn, to make energy, and the other is to get raw materials to build new parts. So when your body's trying to repair your nervous system, what's the quality of raw materials you're giving your body to build these new parts is so important.
So that's why we want to keep it simple and clean, because there's enough that the body's got to do. You don't need another activity that it has to do.
Exactly.
You know, and then one thing that we like to do at Impact Health and Spine Centers is we're looking specifically on the nerve signal that's going from the brain down to those toes to make sure everything is actually working correctly. If that signal isn't clean itself, it just makes everything tougher. You're going to need more of that infrared energy,
exactly,
you know, to get things done. And then, as Hal brought up before, if you're having issues with the fascia or with the muscles in the forearms and the legs, that's also going to affect things. How so, Hal?
Because it's going to kink blood supply, it's going to affect and kink nerves, but it's also going to interrupt blood flow into the muscle, which makes that environment much more toxic as you use those muscles, and you can't wash the exhaust out of the muscle, and that increases the toxicity to the nervous system.
So if we can get that blood flowing a lot better, and we can get the quality of the supplies that are being carried within that blood to be cleaner,
exactly,
and simpler from your diet, and there's a lot you can do to recover from peripheral neuropathy, and it doesn't have to be something that you have to suffer with unduly for a long time.
So people need to know that there's hope for all these conditions that conventional medicine may not have the answer for. And when you try to wonder, what should I do first, second, or third, and how will I know if which thing made the most difference? Your body doesn't work that way. Your body needs everything done at once because you need all the parts done at once. You don't build a bridge by putting all the bolts in from one side and then you go back at the end and put all the nuts in on the other side. You put them both together at the same time. You need all the parts to make things work. So you don't just do one thing at a time. You do everything that you know, and then you see how much change you can affect.
So get out there and build your team. And if you need some help with that, please reach out to myself, Dr. TJ Long at Impact Health and Spine Centers, and
Dr. Hal Blatman, Medical Director, Blatman Health and Wellness Center. And you have a nice day.
I'm Dr. TJ Lonergan with the Impact Health and Spine Centers, and I'm here with Dr. Hal Blatman.
Medical Director for the Blatman Health and Wellness Center.
And we're going to talk to you a little bit about what you can do to prevent a neuropathy.
Right. How do you prevent it? Like your nerves are about to be damaged, or you've got an illness, or you're taking medicines that could injure your nerves. How can you protect them?
Well, one, a lot of this comes back to your diet. It's a really simple thing that you can do for yourself outside of seeking counsel from somebody who can give you a little bit more specific things on what to do. And one of the major things you want to look at in your diet is what, Hal?
I think that you want to stop eating the things that can cause further oxidative stress or further injury to your nervous system. So that's going to be bread flour, sugar, artificial sweeteners. The things on the inflammatory food list need to come out of your diet.
Where do I find an inflammatory food list?
I think you might find that online.
Right.
Right.
And keep it real simple.
Or you can sign up for our newsletter and download what we call the Do Not Eat list.
And so these are things that you can do specifically for yourself, but another thing you can do besides just the food at the grocery store is you can look into supplementation. There's a lot of good supplementation, nutritional supplements that can help you kind of prevent and fight this and raise your resistance to this happening.
And we've used these nutritional supplements to prevent and also reverse diabetic neuropathy for many years. And they also will help protect the nervous system from a chemotherapy neuropathy.
So if I'm hearing you right, Hal, I can actually do something myself to help my neuropathy and help my health, and I'm not stuck with this the rest of my life potentially.
Yeah, we'll talk about that in our next episode. But you can actually prevent it if you do these things while you're being injured from your chemotherapy or your diabetes. You can help prevent the damage to your nervous system. But it's not always that. Sometimes that neuropathy is mistaken from something else that's going on in the body, and it's not just a neuropathy.
Sure.
Like
when you found the nerve back up, that nerve's got to make it all the way back up to the brain. It's got to go from the brain all the way back down to the toes or the fingers, and anything that's disrupting that signal anywhere along the line can have a problem. And it could be something as simple as in the spine itself and how it's motioning or moving. That's why something like yoga or Tai Chi or just a daily walk or getting in a swimming pool can keep that spine loosened up so that those signals run free and there's less potential for a problem to happen.
Right.
So if you're kind of getting it on the physical side and keeping yourself healthy, and you're getting it on the chemical side and keeping yourself healthy, we want you to know also from a mental perspective that you can get yourself healthy. It's not just a fait accompli.
We also see people who have very, very tight calf muscles and very tight legs. And that fascia tightness can interrupt blood supply to the nerves, make the environment very toxic. And for those people, they have something called an idiopathic neuropathy. They don't have diabetes. They've never had chemotherapy. And what we find in those people is it's not really a neuropathy. If we can release the fascia and detoxify the fascia in the legs, the feeling and sensation come back.
So the big question here is, what do I do? And I think, we're going to talk about that here in a minute. But what we want you to know is that there's options.
Right. There are options to do, and you're not just destined to not be able to feel your fingers and your toes. You can actually protect them and clean up your act.
Well, I've learned a lot today, Dr. Hal, and I think this has been great. And we hope that you're learning a lot from this too. And we really invite you to send us questions, and we'd love to answer them for you. I'm Dr. TJ Lonergan with the Impact Health and Spine Centers.
And I'm Dr. Hal Blatman, Medical Director of the Blatman Health and Wellness Center. You have a nice day. Hello, everybody. Today, we're going to talk about headache, what they are, how to make them go away, and we're also going to talk about New Year's resolutions. Is it something that's important? Is it something we should be doing? Is it something that's even helpful or even useful? And I'm here today with
Jen Beck.
Say good morning. Tell us a little bit about yourself.
Sure. Good morning. My name is Jen Beck. I'm a registered nutrition consultant and a certified lift practitioner. I own Complete Health Revolution, and we help you to reclaim your health and recharge your life by figuring out what you need to be eating and also what's eating you so that you can create lasting habits and lasting change. And we're also here in Cincinnati.
And you see people with headaches.
I do.
And we all have some success in helping people make them go away. What do you find is most important from the pieces that you add to the puzzle?
For me, it's always about starting at the fundamentals and starting people with small, basic changes. And one of the most important things that I see beneficial for many people, especially with headaches, is water. It's the simplest thing, and it's so simple to do, and yet it's so simple to forget about too. But just hydration is massively beneficial for helping people to diminish headaches.
A friend who says you should be sitting all day long with a thing of water next to you. Every time you see it and look at it, you should be taking a sip. And every time you empty it, you should refill it and repeat the process all day long.
I would completely agree. Hence my 32-ounce glass.
People not only not drink the water, they drink so many things that are counterproductive.
Right.
The possibility of health. Soda is not something we should be drinking. Fruit juice is not something to be drinking.
No.
All right, well, we'll get back to that. Let's talk about headaches, where else they come from. Headaches don't come from your head. That's probably the first thing people really need to learn. We go to the neurologist, we go to the head doctor, we go to the spine doctor. They tell us all kinds of things, but the headache generally does not come from your head. We were taught as doctors it comes from the blood vessels in your head and in your neck, maybe because you can feel it pounding. That's really not true either. What you're going to find is that pain in your body comes from the places that are tender. So, where are the things that are tender that cause headache? Jen, you know some of these, right? In your neck and shoulders and upper back?
Yeah.
So, here's one way to find them. There's a muscle right here along the front and side of your neck. It's a really big, kind of thick muscle. Take that, and you can grab hold of this muscle. You can pinch it between your index finger and your thumb, and you can feel that within this muscle, there's ropey, tight bands and ropey, tight cords in this muscle. Well, the places where these are tight and the places where these are most tender, that can generate headache. And the diagrams have been around for a long time, and that's this one, right here in the front center of your screen. And these X's represent the ropey, tight bands, cords, where the nerves in that muscle are really being pinched by the muscle. And then those red speckles that send the pain up this way are where the pain goes. And if you take this muscle and you maintain pressure on it, and you continue to hold pressure on it, you'll actually feel that pain pattern if this muscle is sensitive or not. Well, where does the injury come from that causes this? Now push in a different place on your body. Go ahead and push right on the top of your collarbone, not on the front, but push in and then push down against the top, right here toward the middle. And you're going to find there's little lumpy areas, difference in texture that isn't quite smooth, and they're surprisingly tender. And these are the injuries that cause this to happen in your muscle. And just like this muscle causes this headache pain pattern, you'll also find there's other muscles in your neck, your upper shoulders, and these are the areas that contribute to the orchestra of injuries in your body that contribute to the pain you identify as a headache. If you can make all these kinks or knots in your fascia cords and strings smooth out and go away, and if you need to make these injured areas from way back in your childhood heal and help them get better, that's how you make the headache go away. But what glues this together is what we need to talk about in resolutions, right? Or what we need to talk about in how to change our body and how we think about it. Because what glues this together and what lights up this injury from many injuries in your lifetime, lights this up kind of like plugging it into a socket. That's the food that you eat that you don't even know is causing you pain. So we're going to talk a little bit about that, and then we're going to talk about how do we make those changes, and our New Year's resolutions, even should they be in the game? Are they important? Do they work? So let's talk first about which foods cause most of the pain and especially headaches. What do you find, Jen?
So through working with clients, I would say that dairy, gluten, sugar, for some people, grains, for some people, eggs and soy are some of the major ones.
I will totally agree with that. And so I find that these muscles in your upper shoulders, they can be tight and they don't have to be tender. If these muscles are tight and tender and you have not yet taken dairy, gluten, and sugar and artificial sweeteners out of your diet, you're really missing out. And you're not even knowing how much of that can be causing this pain. And don't you owe it to yourself the curiosity to find out if taking these out of your diet really makes a difference? And most often you have to take out the trifecta. You can start with just one, and usually the one you start with is the one that's least painful, because the ones that are more painful are the ones you think you're bound to and you want to use all the time. But really, if you take one out and you're not better, don't say that didn't work. You still need to take the other ones out.
Yeah, I think that's a big point, Hal, because I think there's a lot of people that go gluten-free or they go dairy-free and they're like, well, that didn't do any good, without realizing that it's the combination of factors. I mean, some people occasionally, like I have people that they can eat bread and then they can eat cheese, but if they put it together, it's disastrous. Not understanding that there's inflammation caused by each one all the time. It's just amplified when you have multiple things in your body at the same time.
And it's not like 1 and 1 makes 2. It's like 1 and 1 makes 6.
Yeah.
And then there's the other issue right along parallel with that of people going, well, I'm mostly gluten-free. I only have a little bit of cheese. Maybe I only put a little bit of butter with my. What do you say to that?
Well, so you can have a little bit of arsenic too. Do you want that?
Very good point. You can have just a little bit of pregnancy. You're still pregnant.
Right.
Right? You don't get just a little bit. So, and I talk to people about how this is an effect on your immune system, right? This isn't just talking to your headache. And what if your immune system was sensitive to the sting of a bee, right? There's people pretty allergic to bee stings. How many bees does it take to kill you?
1.
Yeah, or even less than that. What if the bee only partly gets you? It's like half a bee, you're still done for. Or what if you're the person on the airplane and somebody opens a bag of peanuts? They now tell you when you get on the airplane, sorry, there's somebody on here today with a peanut allergy. There's be no peanuts and don't open any on your own. I mean, they're pretty vocal about that. So to think that you can get away with a little bit of butter when you're sensitive to dairy, often doesn't work. But how can you tell? What is the timing? Listening to us in this format is wonderful. But if we can teach you as the person how to listen to your body to know what it's telling you. And so what are the signals? How do you teach how to listen to your body?
Well, so for me, when I work with somebody, I actually have them monitor how they're feeling 30 minutes to an hour and a half after they eat. And we're looking at things like pain, digestion, energy, mood, headaches, really anything that is different. And because when you can start creating that correlation to I just ate something and now I feel off, that's a big factor and it's a big awareness. But I always remind people that it can be up to 3 days before you actually see a full reaction from a food you've consumed.
Great point. You're really lucky if you can tell in 2 or 3 hours. You're really lucky if your body is that fine-tuned that you can know. But a lot of people they don't know till 12 hours later. So what I talk about is, if you wake up in the morning with pain you didn't have last night when you went to bed, and you don't remember falling out of bed or getting hurt during the night, it was something you ate last night that set off your immune system and lit you up.
Can you hold it closer, Hal?
If you go to bed in pain,
There you go.
you didn't have this morning, then it was breakfast or lunch. And that's the way we talk about it. And those are probably the earliest signs, but you're absolutely right. Can be 36 hours. Can be you created the injury by doing some physical activity that strained some muscles. And then you ate something the next day while this injury was still healing, it will light that up. We should be able to repair our small injuries under our radar without our body even telling us. You should be able to go out and do physical activity you're not used to, if it's not over the top, and not be sore the next day like you expected. The reason you're sore is because your body's showing you the injuries you had yesterday that it cannot repair under your radar because of the information from your food that Yuri mentioned in this talk. So let's go to resolutions. You don't like them. Can you talk about that?
Well, I think they set us up for failure. We as Americans have been molded with the diet industry to do all or nothing. And so people go, all right, this is it. This is year I'm going to get healthy. I'm going to go to the gym. I'm not going to eat any more sugar. Carbs are gone. I'm going to have a dry January. I'm not going to drink anymore. Like I'm all in. I'm going to do it. And your brain goes kicking and screaming into activity for a day or two, or maybe a couple of weeks. But its whole goal is to be able to drive you back or drag you back into the comfort zone. So creating a massive overhaul of your lifestyle like that isn't sustainable because it's too much too soon. Not to mention somebody who hasn't worked out in a year or two or even 3 months is going to go to the gym and get sore. And our brain goes, we don't want to be sore. Mm-mm.
That's right. I didn't like getting up early. I don't like this whole drill. I think I'll do this for a week.
Yeah.
And
it's like,
it
why
might
bother?
last
And
a week.
right. Well, and they say that, what is it, like 64% of all New Year's resolutions are done by the second week in February, if not sooner. Like that's the 64% at least are done.
Because those people are successful and accomplished every goal they set out for?
Right. No, because they're overwhelmed. They beat themselves up. They've got cravings. They haven't fully committed to the full picture, and they have a life outside of their health. And so what I teach is how to create a lifestyle. So it's small, sustainable changes. So you're layering success on top of success on top of success. So your brain goes, this is uncomfortable, but we didn't die. We actually feel kind of good. Okay, what's next?
Yeah. And I think that if you make the changes with the same level of discomfort, if you keep pushing your envelope with the same level of discomfort, you get where you need to go.
Mm-hmm.
Maybe the first change has a level of discomfort, and don't rest on that. You accomplished that. You've made it happen. Now take the next change. Don't take anything bigger than the first one. But now, like, you couldn't have taken those two at once, but you could take them now one at a time. And then don't rest on your laurels. When you're comfortable with that one, it's time to make the next one. And that actually is possible. You kind of do the same thing, right?
Yeah, it's about baby steps, right? So when I work with a client, we set 3 baby steps that are a stretch, but that they know for a fact that they can do no matter what, right? Because we've got to get our brain on board. Water is a really big place to start because most people are chronically dehydrated in America. And so getting them to drink half their body weight in ounces of water per day is kind of a minimum. But some people, like I have one gal, she was drinking 240 ounces of coffee a day and 1 bottle of water every week or 2. I mean, she was on coffee 24/7. She was doing laxatives because she didn't have the ability to have a bowel movement without them. And so I talked to her about water and she's like, okay, so if I've got to do that, and for me, really looking at how do we compensate for the other things that we're drinking, right? Like diuretics. Coffee is a diuretic, so it pulls the water out of our body or pushes the water out of our body. So, compensate for every cup of coffee you have with 2 more glasses of water. So if that was the case,
be in the bathroom a lot.
absolutely, right? So 240 ounces times 2, that's 480. She was about 200 pounds. So that's another, so she's at like 560 ounces of water a day based on just what she was drinking in coffee. Not going to happen.
560 ounces. That's how many gallons?
About 4.
That's a lot.
It is. And never would I tell somebody to drink 4 gallons of water in a day. You flush out all your electrolytes and everything else.
Right.
But the goal is to be able to make small changes. So for her, it was the gallon challenge, right? You don't have to give up your coffee, but start drinking a gallon of water a day. It's 4 of these, right? And when she started drinking more water first thing in the morning, she didn't need the coffee. Shocking. She needed a little bit just to be able to take the edge off the headache because she had caffeine withdrawals, but that lasted about 3 or 4 days. And then she was drinking a gallon of water a day and felt amazing.
And the same thing happens with food. You miss it at first, but you start to find a week later that you feel better. If you're a chronic pain patient and you've been taking pain drugs, you're going to find that they start to work better.
Yeah.
And then you find out, when you were a child and you did something mama told you not to do, didn't you get smacked upside the head at least a little bit? And, some people say, no, my mother never did that. And I look at them and go, well, your body's teaching you what your mother didn't teach you when you were a child. Now, every time you do something your body asked you not to do, your body smacks you upside the head and sends you to your room. Now that's a headache. It's your back pain just got worse. It's you picked up a Kleenex and you thought you threw your back out, but it wasn't the Kleenex. It's the inflammation from a tweak you did in your strings as you picked it up that would have never happened had you not eaten what you ate yesterday.
Yeah.
Yeah. So
totally agree.
Learning how to do that is so, so important. And when we use our injection techniques and we take all the tenderness and all the hardness out of this muscle and make it soft like a baby's muscles, so to speak. If you glue this back together and your pain comes back in 2 days, it's almost always your food. So take that out now before you come and see us and see how much better you are. And then when we do body work on you and do loosen you up, you stay loose for a lot longer. It's a whole lot more fun. All right, we want to open this up for questions. But before we get to that, I want to just take just a minute. We decided at the Blatman Health and Wellness Center just in the last few weeks, we're going to put on a program the first Saturday in February, right before, a week before Valentine's Day, 6 hours talking to people about what food do you need to change? How do you do it? How is your body put together? What is your anatomy really like? And then how to help you make your headaches go away, your neck pain go away, lower back pain, foot pain, and carpal tunnel syndrome. We're going to talk about all of them over the period of 6 hours. There'll be an admission price. Look for information on our website. Look for information online, and we'll be glad to talk about that very, very soon. And right now, let's open this up for questions. If you have a question to ask for me or Jen, please unmute your microphone and speak up, or make it on the chat piece. And I hope this is loud enough, and thank you very much for the suggestions to do that. Are there any questions? Yeah, go ahead.
I've got a question. First of all, thank you very much, both of you. My screen wasn't showing you at first, Dr. Blatman. Could you show which muscle you were talking about?
Yeah, this muscle right here in the front and side of your neck that comes down and attaches on the top of your collarbone that you can grab this way.
Perfect. Okay? Thank you.
And this makes this pain pattern that goes across your head and is often part of migraine and also trigeminal neuralgia, so-called pain, and also so-called TMJ pain sometimes.
Sweet.
All right. Well, thanks everybody for attending and listening. Jen, thank you very much. Do you have any
Thanks
last
for having
words
me.
to say? Hello?
Just remember baby steps. Instead of New Year's resolution, set a New Year's intention. What kind of health do you want to have in 2021? What do you want to create? What are the first steps that you can be able to take? And then just keep making new changes, going in the same direction. So think about going from here to LA, right? You can be able to go in a straight line, or you can take 1,001, potty stops. As long as you keep going, you'll eventually get there. So set your intention of where you want to go, what you want to create, and keep moving that direction.
Point yourself toward the star of light, aim for that beacon, and have a wonderful day.
Yeah. Hey, Hal, we've got one question from Katie. She was asking about foods. So the biggest food contributors were dairy, gluten, and sugar, artificial sweeteners. For some people, eggs. For some people, soy. I've also seen a lot of people with MSG and even some food colorings. So it really depends on the person, but the big ones are soy, gluten, and dairy, and sugar.
And don't forget about fake fat.
Yeah.
Cool Whip, Miracle Whip, Crisco, vegetable oil, margarine.
Margarine.
Not your friend.
Mm-mm.
All right. Bye, everybody. Have a wonderful day.
Bye, guys.
What does it take to save a joint? A finger joint, a knee joint, an ankle joint, a hip joint, a wrist joint. They all have the same kind of physiology. They've worn out ahead of their time. The other joints in your body are more okay than this one or two. And so now you've been told that your joint is bone on bone. I've already shown you, check out the videos. How do you know how difficult it's going to be to save your knee? How do you know how difficult it's going to be to save your hip? But when you go to do the process, the big deal is, can you balance wear and tear with your biologic ability to restore? There are orthopedic textbooks that say once your cartilage is worn out, you just can't do anything but replace the joint. And I started to wonder many years ago whether that was even possible to be true. I mean, look, you grow new skin every 7 to 10 days. You grow new fingernails. You grow new hair. You grow new brain cells and new heart cells. Does it make any sense that our biology can't repair cartilage from daily wear and tear? So the reason this joint wore out faster than the other ones is you have an injury to that cartilage sometime in your lifetime, maybe multiple injuries. And those injuries have injured the resilience of the cartilage, so it wears out faster in that joint than all the other joints from normal daily wear and tear. So how can you correct that? Two things need to happen to balance this equation, or there's two places you can reach. One is to wear your cartilage out more slowly, and the other is to grow it more quickly than your body can do on its own. To wear it out more slowly, we teach you to take smaller steps. We teach you to use elevators and escalators. We teach you how to preserve the joint. And then to grow cartilage more quickly, one of the things that becomes most important is you need to do something every single day that can help you grow cartilage more quickly. And for that, we rely on glucosamine. Well, glucosamine works for knees. Glucosamine by mouth works for knees as long as you have a brand that works. If you've been taking glucosamine for your knees and you have a brand that works and you don't think it's helping, it's not because the glucosamine isn't working, it's because your pain is not coming from your joint. The pain comes from the fascia and the tissue that holds the joint together and helps the joint to move. For your hip, oral glucosamine supplements, I've never seen them work. Not the hyaluronic acid, not anything. The thing that works best to help your body grow cartilage faster for a hip joint is glucosamine through your skin applied with a cream. And we've actually developed a cream that's prescribed in the pharmacy that you can use 3 or 4 times a day on most any joint in the body, and it will help that joint recover. Well, there you have it. That's what you have to do to help balance wear and tear with your body's ability to restore. And then once you have that balanced and you've proven that you can make that work, whatever you do at a point in time, you don't have to talk about how long till it wears out.
because you're sustainable, possibly for your lifetime. And now we can talk about exosomes, peptides, platelet-rich plasma, and stem cells. I'm Dr. Hal Blatman, Blatman Health and Wellness Center, www.blatmanhealthandwellness.com. Look us up. Maybe we can help you. Have a nice day.
Hi there. We're speaking today with someone who's been with me for, just a few months. And can you tell us what this was like when we started? It was in September, right?
Yes, it was. And I was in pain all over my entire body, from my head to my feet. And I had an arthritic hip that was also very painful.
And you had a diagnosis of, was it fibromyalgia?
Fibromyalgia and extensive arthritis in my right hip.
Okay. And so we've done 2 sessions with trigger point injections and platelet-rich plasma. And how are you doing now?
Well, I'm much, much improved. I'm not going to have surgery on this hip, which I'm thrilled. And my fibromyalgia pain is getting better. It's much, much improved. It's not all over my body like it was. And it was in my back, and we just treated my back, so I expect that to be fully gone too.
Lots of people in the world have headaches, and many people find these headaches disabling. What you're not taught is that headaches do not come from your head. It feels like it comes from your head, but your headache doesn't come from your head. It doesn't come from your blood vessels. It doesn't come from your nerves. And medicine pretty much doesn't have the paradigm that helps you. You take migraine medicine, your headaches come back. You take other headache medicines, they come back. One could argue that the medicines don't work because nothing really makes it go away, and that's because all the medicines are dealing with the idea that your headache comes from your head, and it doesn't. Your headache comes from a lifetime of injuries to the fascia and the muscles that make your head and your jaw move. For example, just take a look at this picture. You have tight upper traps, they're really tender, they make this headache. You have tight muscle here, this muscle and these injuries at the ends of this muscle make this trigeminal neuralgia and migraine headache pain. So instead of thinking that your headache comes from your head and taking medicine for the rest of your life that drives you into a corner and gets you nowhere, come learn how to make this fascia injury repair and your headaches go away. When you go to figure out where headaches come from, the best thing to do is examine and touch the fascia that holds your body together and see where it's tender. For example, you can grab hold of this muscle right here, a big thick muscle, about as big as your thumb. And if you run your hands over it, you can feel that there's ropes and cords in this muscle, surprisingly tender. Now, take your finger and go over the top of your collarbone, not the front, but push down on the top and run your finger along it. You'll feel little irregularities that might be also surprisingly tender. Well, this is the injury that causes this rope. And the first time you got that injury, you were an infant, and somebody picked you up by your shoulders, forgot to bring your head. Another time it happened, you were on the playground, 6 years old. Some little kid came up behind you, shoved you to the ground, snapped your head back, and tore where the strings and cords of fascia that go through this muscle and hold it together weave through the cover over this bone to anchor and hold you before they come down into your chest. Take your hand, get a big bite of your pec muscle, run your thumb across it, and feel the ropes and cords in there that are surprisingly tender. Well, you got that injury when you got up off the playground floor and pushed that little kid back. What's the significance? Well, take a look at this. This is one end of the injury. This is the other end of the injury because you're also tender in the back of your head. These are the kinks in those fascia cords and strings that go through this muscle. And this is the migraine and trigeminal neuralgia pain that comes from these injuries and these kinks. Again, let me remind you, your headache does not come from your head unless you're having a stroke or some other terrible thing. Headaches do not come from your head.
Hi there, I'm Hal Blatman, MD, and I'd like to take just a minute and talk to you about head and neck pain. Are you able to take this muscle, just wrap your fingers around it? It's a pretty big muscle. And can you feel there's ropes and cords inside this muscle? And can you also feel that they're surprisingly tender in some places? Now, take your finger and touch the top of your collarbone. Push down and massage just the very top, and you'll feel little irregularities that are also surprisingly tender. Well, this is the injury that causes that. And the way you got that injury, you might have been an infant, and somebody picked you up by your shoulders and forgot to bring your head. Another time it happened, you were in nursery school, and somebody not happy with you came up behind you right before morning recess and shoved you to the ground, snapped your head back, and tore where the cords and strings that go through this muscle weave through the cover of this before they come down into your chest. And the results of that through this time, here's one end of the injury, here's the other end of the injury, here's the kinks in this muscle, and here's the pain pattern of headache that causes.
Hello, I'm Sally Weinrich, and I'm living proof that Alzheimer's can be reversed. For over 7 years, I've been following Dr. Bredesen's RECODE protocol. That's short for reversal of cognitive decline. Alzheimer's starts small. The first symptoms can look like normal aging changes. And Alzheimer's may take 20 years to fully develop. I had aunts and uncles, 2 on each side of my family, that died from Alzheimer's. So you can understand why I was terrified when I had my first major memory problems in 2000 when I was only 52 years old. We were living in a home with black mold, and at that time I had no idea that mold can cause Alzheimer's disease. Now I'm 75 years old. It's 23 years later, and thanks to RECODE, my cognition is good. I am convinced that if I had not followed the RECODE protocol, I would already be in a nursing home with advanced Alzheimer's, or perhaps, even more likely, not here at all. In 2015, before I heard about Dr. Bredesen, I joined a multi-center national study designed to test whether the removal of beta amyloid plaques from my brain would delay Alzheimer's. I stuck with it for 8 monthly treatments, but then I withdrew because each treatment made me even more confused than I was before the treatment. After my husband showed me Dr. Bredesen's article on reversal of cognitive decline, I decided to try RECODE. I have discovered more benefits in my life from following RECODE than I can begin to name. There are also challenges. For example, my brain thinks much more clearly when I eat a plant-based ketogenic diet. A small device that I breathe into measures whether I am or am not ketogenic. Limiting my carbohydrates can be tough. I really miss my whole wheat bread. Some days I do leave out parts of the protocol, but most of the time I just do it and tell myself I'm going to keep my brain working. If not for myself, then I'm doing it for the ones I love. The RECODE protocol includes physical exercise, since exercise increases the blood flow to the brain. After exercising, I notice right away that I'm thinking more clearly. I'm currently practicing for a 2-mile swim across Lake Murray here in South Carolina. Each time I practice, I try to swim a little longer. This is kind of like the RECODE protocol. I keep doing it regularly, and my brain gets a little bit better each time. Practitioners trained in Dr. Bredesen's RECODE protocol, such as Dr. Susan Brott, have been essential to my recovery. They have identified and treated undiagnosed contributors to my cognitive decline, including sleep apnea and toxins. Today, I no longer have those awkward conversations where I cannot remember what I want to say. And most importantly to me, I don't get mixed up and call my grandchildren by their wrong names. Following the RECODE protocol has kept my life worth living, and it can do the same for you. And so I invite you to consider, right here, right now, in what way does my story apply to you? How much do you want to keep your brain and your personality How will choices you make today not affect only you, but the ones you love? Thanks to Recode, I look forward to treasuring what brings me joy, my family, my friends, and beautiful sunsets. What are you willing to do to create a future you can treasure together with your loved ones?
Of the over 328 million people in the United States, 45 million are expected to develop Alzheimer's disease during their lifetime. Healthcare is currently undergoing a transformation from 20th century medicine to 21st century medicine. 20th century medicine relies on small data sets for traditional diagnoses, which do not answer the question of why the illness is present. This one-size-fits-all approach has been thus far unsuccessful in treating chronic illnesses such as Alzheimer's disease. This brings us to the transition to 21st century medicine, which uses large data sets for diagnoses and helps identify changes in the network of the human body that characterize chronic illness. We can reveal the why for each individual and address the cause of each condition in a comprehensive, personalized, and pragmatic way. This transition combines the best of Western medicine and Eastern medicine practices. Using the 21st century approach, we have found that treating Alzheimer's is analogous to repairing a roof with 36 holes. Treating the disease requires addressing many aspects of the body at one time, as you would when repairing holes in a roof. The more holes you cover, the more success you will have at fixing the problem. Current pharmacological approach is focused on developing a drug to combat Alzheimer's. If we were to create a single drug specific to Alzheimer's, it would have to perform so many different functions that it would be unlike any drug ever developed. While the single pill approach may not be a viable option, by knowing the characteristics of the disease, we can address the underlying problem and patch 36 factors, or holes as we referred to them in our earlier analogy. This approach is the cornerstone of the Bredesen protocol. To understand the problem of Alzheimer's and why neurons in the brain degenerate, we need to look at it from a cellular level. Higher organisms rely on 4 developmental processes: proliferation, differentiation, migration, and integration. We also rely on these processes for the repair and regeneration of cells and neurons. This cyclic routine creates a lifelong need for balance among these processes. When this balance is disturbed, it can result in the development of diseases, such as cancer or Alzheimer's. In cancer's case, an imbalance towards an increase in the proliferation and survival against programmed cell death leads to the development spread of cancer cells in the body. On the other hand, Alzheimer's occurs when there is an imbalance in the migration and integration processes that are critically involved in plasticity, a term that refers to changes in the brain, such as the making and breaking of connections between neurons. These connections are referred to as synapses. The amplification of Alzheimer's occurs at the molecular species level in the form of prionic loops, which are created by the interaction of various molecules with amyloid precursor protein, or APP. Genetic and biochemical studies have revealed that APP is central to Alzheimer's disease. APP acts as a mediator in the formation of synaptic connections and in synaptic organization. In Alzheimer's, there is an imbalance among these 2 factors, which results in greater synaptoclastic activity than synaptoblastic activity. This is to say, there is more breakdown occurring in a synapse through neural retraction and synaptic reorganization than there is formation, which results in an overall degeneration within the synapses. We have discovered that if you cleave APP, we can recognize the 4 peptides that mediate neurite retraction, caspase activation, and synaptic reorganization. As we mentioned before, these processes are associated with Alzheimer's disease and can result in degeneration within the synapses. If APP is cleaved alternatively, we can identify the 2 peptides that mediate the opposite effects, which are neurite extension, the inhibition of apoptosis, which is a form of programmed cell death, and synaptic maintenance. By recognizing these peptides, we can identify all of the risk factors that contribute to Alzheimer's and our roof with 36 holes analogy, whether they be hormonal, traumatic, metabolic, or some other form of abnormality. Interacting with and covering many of the factors we have identified thus far leads to unprecedented results. For example, over the course of 2 years, a 71-year-old participant of the Bredesen protocol has increased his verbal learning test score from less than the 5th percentile to greater than the 80th percentile. His auditory delay memory score also saw significant improvement. It went from less than the 15th percentile to greater than the 75th percentile, and the list goes on. The combination of large data sets, genetic data, the underlying biochemistry, and the concept of 21st century health has contributed to the formation of the Bredesen protocol, the first proven method to reverse the effects of early Alzheimer's disease.
Introducing the Bales Photonics Firefly, the latest in multi-spectrum LED light therapy for pain, neurological disorders, and pathogen issues. Clinical studies indicate that the Firefly may be able to reverse the symptoms of Parkinson's, Alzheimer's, and other diseases. The Clinic Pro allows the practitioner to operate 2 wands simultaneously and includes 2 inputs from 2 external frequency sources, with the added advantage of frequency mixing. Firefly multispectrum therapy emits packets of light called photons. These light packets break the painful inflammatory cycle that many diseases cause by dilating small blood and lymphatic vessels. This increase in circulation removes the body's inflammatory products and provides patients with accelerated healing and pain relief. Firefly, changing lives by harnessing the healing power of light.
I get to see that every day in my practice because most of my practice now is using light therapy for so many different conditions. So it's been an incredible journey with you, Maurice. The day I met you was a day that changed my life.
The original photonic stimulator, which my father Maurice created in 1998, output 250 milliwatts. As of now, one of our wands for the Firefly is outputting 37,710 milliwatts, well above any of the class 4 lasers or any of those devices which carry a much heftier price tag. The near-infrared has been shown to permeate at our power levels up to 20 centimeters, which is 8 inches. So that's the second advantage, is not 1, not 2, but 8 different wavelengths that can be used in any combination. We are very excited with the treatment of neurocognitive conditions, including Alzheimer's, dementia, Parkinson's, multiple sclerosis, and even ALS, Lou Gehrig's disease. Another great feature of the Firefly is my father Maurice's design of very complex electronics to create different waveforms to potentially kill pathogens, viruses, and bacteria, and parasites. The patient is first scanned with an energetic testing machine called F-scan. And in 2 minutes, the F-scan software is able to come up and tell by name all of the parasite, bacteria, and viruses that the patient's immune system is fighting, and the frequency, the resonant frequency associated with those pathogens. I had one patient pass a 3-foot tapeworm after one Firefly treatment, after an F scan, of course. The patient that passed the large worm was a 38-year-old female with mental fog and fatigue for no reason. After passing the worm, she was back on herself, and she had been suffering with this for 5 years.
2 weeks ago, I came and I did my very first treatment, and immediately, that very same day, I saw results, and I'm just so pleased with the treatment that I'm receiving. The neuropathy is almost all gone, and I'm just amazed at how it's helped me so quickly.
What's going on? Can this be that powerful? And it works on almost everybody? This is revolutionary. What's the matter with the world? It needs to wake up and see what this does, and that it can work.
Good morning and welcome. I'm Dr. Hal Blatman. I'm here today with
Shauna Elvisser. How are you?
And Sean and I, we've worked together for a number of years. Sean is a nurse, very familiar with pain. We're going to have a discussion today about pelvic pain. And welcome to you, and hope you enjoy this and learn from it. We were just talking just a couple minutes ago about how pelvic pain starts at childbirth.
Yes. If you get to go the natural route, whether you have the epidural or not, there is pain that you will feel hours to days and even weeks, months, and years later.
Mm-hmm. And some women have pain for years after childbirth and attribute that pain to the childbirth injury. Some women don't develop pelvic pain till they're teenagers, and it's menstrual cramps and menstrual pain. So we can talk about that. And then we have pelvic pain that maybe starts with childbirth, maybe doesn't start with childbirth, but has something to do with injuries that happen in other ways. We start to injure our thighs and our pelvis when we start jumping down the steps as children, when we bicycle, when we run, when we land in an unfortunate way on the parallel bars or I-beam or however that goes. What kind of injuries do you see, Shauna, when you think about pelvic pain?
Personal experiences, you did mention a couple, those misfortunate slips off the bicycle. I remember when you said jumping down the stairs, some folks jump up the stairs as an exercise. Mm-hmm. My oldest was just doing that yesterday while I was at work. He was, just jumping up the stairs while I was cleaning up, and he kind of like tumbled back. I would say probably my biggest sources of injury to my bottom outside of having 4 babies would have been, I spent many, many weekends roller skating and falling on my bottom on the, on the roller rink floor.
And I didn't even mention falling on your tailbone pain. That's a big one too. So, when women and men, because this is both, have pelvic pain, men often get diagnosed as prostatitis. Women often get diagnosed as interstitial cystitis because sometimes it starts with burning when we urinate. What are some of the other diagnostic words that get jumbled into this pelvic pain mess?
I would say a lot of times, honestly, doctors sometimes just kind of even write it off. I mean, if I'm talking about like from an internal hospital standpoint, unless they can actually like pinpoint a diagnosis that they can intervene with, they usually just, push that patient to go see someone, some specialist outside, whether it's a female doctor or a pain doctor. But, you see things, especially with, certain other diagnoses or reasons people come to the hospital. They might, say, oh, well, you have pelvic inflammatory disease, or trying to think.
Pelvic inflammatory disease, while you bring that up, that actually was my start in the whole concept of pelvic pain. I was working in this clinic, and it was a Sunday morning, and this woman came in with pelvic pain. And her story didn't fit, but her physical exam was intense pelvic tenderness. And everything in my book said this is a pelvic inflammatory disease. Intravenous gets started, ambulance gets called, and you're on your way to the hospital. But her story didn't fit, and she was about, 15, 20 years my senior, and I looked like Dookie Howser in those days. So I looked at her, and I always scratch my head, and if I had overalls, I'd adjust them too, whenever things really don't fit. And I said, instead of a pelvic exam and starting an IV and calling the ambulance, do you mind if we just stretch out the muscles in your belly? And I had been given a monograph, 30-some pages, by Dr. Janet Travell a few weeks before by a medical director of the urgent care I was working for. And I went into the book bag, my little office there, and I opened this thing up and turned to the page on pelvic pain. And it had diagrams of how to stretch a person out and a diagram of what the pain pattern should look like. And so I laid that out on the table, and she got up on the exam table, and I'm like looking at the pictures because I'd never done this before. And I'm moving her body like what the arrows said on the pictures. It took about 5 minutes, and all of her pain was gone. And this abdomen that was extremely tender, especially below the belly button, was totally nothing. Soft, not tender. Now I'm really scratching my head and adjusting my overalls. I'd never seen anything like this before. And I don't believe anything I can't touch and feel. So I got permission to call her back in a week. I called her back in a week. The pain was still gone. So I read the rest of the article. And I learned that every muscle in the body can generate a pain pattern. And then as you and I were working together, we came across the idea that, well, maybe all of our pain comes from that. And indeed, 80% of the information that comes to our brain from our periphery, arms, legs, whatever's outside of the brain, 80% of that information comes from nerve endings in between the cords, strings of fascia that go through our body and hold it together. The nerve endings in between these strings provide 80% of the information that comes to our brain. And most of what's in pain is the distortion in our fascia that those nerve endings pick up. And how do we find those in our patients?
Well, you have to do a thorough physical exam.
Right.
And where you always differentiated that from other orthopedics or doctors that I've worked with over the years is you don't just look at how the body moves and focus on your joints and a painful nerve test. You actually touch the body, touch the muscle, touch the fascia, and see where those individuals actually experience the most pain based on where you're touching.
Exactly. So what we learned as we were working together is that you can't believe what you feel. You really can only believe where you're tender. And so for the person in pelvic pain, if we're looking to find the source of the pain, after you know about your bladder, after you know about whether you have a fractured tailbone and other things like that, the next step is to find out where you're tender. And a lot of folks with pelvic pain, their tenderness is going to be the muscles on the inside of their thighs, the muscles on their buttocks, and the areas where those muscles attach. So we started to make an analogy so everybody can touch their neck. And so if you try yourself, you can grab hold of this big muscle that runs right down here in the front of your neck, get a big bite of it, and most everybody can feel as they come across this muscle that there's tight, ropey, tender ropes inside that muscle. And you also can feel that some of them, somewhere along this line, are way more tender than you ever expected them to be. Well, those kinks in these diagrams, like the one I had with that pelvic pain person way back when, make this pain pattern. And how did you get these? Feel the top of your collarbone, not the front, But push in on your neck muscle and feel and push down on the top, and you'll feel these differences in texture that are also surprisingly tender. And this is the injury that causes that. How'd you get this injury? It might have been nursery school when somebody came up behind you and pushed you down and shoved your neck back and tore, where these collagen fibers attach and weave to the cover over this bone. And you wear that around now, remnants of that injury with this tenderness and these ropey bands. Same thing happens in the pelvis. Where do we find them, Shauna? I'm going to find the picture while you talk.
So if we're talking about where we would, touch on those, well, one, you do begin to squeeze those inner thigh muscles. And then you can, generally those are tender for individuals that are complaining of that severe pelvic or, lower abdominal pain. But also, just feeling around, your pubic bones and even around like the buttocks, kind of working your way up to, your rectum. You generally, you can feel that just intense, you're feeling the changes in the muscle and the fascia, and the patient saying, yes, 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 that's exactly where it hurts.
And here's a diagram that we refer to, this one right up here in the corner, how the muscle that we call adductors on the inside of the thigh send pain that to us is going to feel like it's in our bladder or feel like it's in our prostate. And then the muscles that you were just talking about, that's everything that attaches to these bones of the pelvic floor. And just like this clavicle was tender, you need to go down, feel your pubic symphysis, and feel those bones as they go back toward your sit bone. And if those are tender, those are the attachments, just like this, that were injured when you landed jumping down the stairs, or when you landed off your bicycle, or God knows what other, or the tear from the inside during delivery and childbirth. And men, except for the childbirth thing, it's not any different. Only oftentimes we don't get the bladder symptoms, we get things that we attribute to prostate. And so if you've been working on this for a long time, and you've had pain for a long time, and your pelvic floor therapist is helpful, and every time you get your muscles stretched out, your pain gets better, and then it keeps coming back. So really, you end up in this cycle of how do you survive, right? And you go in between your therapy appointments, and they get you back in shape so that you can go and wait another couple weeks till the pain's bad enough to go get some more treatment. And what needs to happen is that these knots and cords in your muscles need to be more ignorable. And these injuries where you hold together, your body needs to repair them. And the problem is that your body has no idea that it didn't repair you the first time, and the second time, and the 100th time. But if you're still tender, that means your body didn't repair you enough. And just like this is tender and perhaps you have no clue, there are other parts in your body that are tender that you have no clue about. So when you go to heal the wounds that have given you a lifetime of pelvic pain, it's not about being 100% perfect and 100% restored. Really, all you need to do is restore everything to where it's 99% ignorable, just like this, and just like other places in your body that would be tender, but you don't actually walk around with them. So, Shauna, let's just talk for 2 or 3 minutes before we end. Give folks an idea of how do we make it go away once we find out where you're tender and we find out where the pain comes from. How do we get your body to heal?
Well, there's, it's kind of a multi-layered experience. There's, the greatest success when you take all of the knowledge and the science that we, Dr. Blatman would give you as far as, ways not only that you can heal that pain, whether we're using regenerative medicine like, PRP, and other, like stem cell factors that can help your body actually heal and know that it did it incompletely. We create a small new injury and place those parts there so that it can kind of give your body a little bit of assist in building new healthy, anchoring fascia, things of that nature. But also, if you want to get it ignorable, you have to take into account that this means you can't have Mountain Dew and you can't smoke your cigarettes because those are, toxic to our bodies, and it's going to create just an overall general higher level of inflammation. So if you already have those injuries, you're just going you gonna put the spotlight on it when you have your body full of you know bad food.
Right.
Your body
Exactly. And that's so important. There's a few basic things that need to happen for a person to heal. The physical trauma and the engineering failures of our body to hold itself together from those traumas, that's mostly ignored because you go to your doctor and you're going to get a drug and medicine to help make your brain ignore all these injuries. And then you need to change your food, change what the environmental toxins and poisons are doing to you. And all those parts are part of your biology to try and restore itself. And so if you're really going to work on this pain, all of that needs to be taken into account. And then God knows what's been going on in your head for the last how many years that you've had this pain. Can't ignore mind, body, spirit, and what goes on with that. So we look at a whole biologic restoration to deal with all these facets of pain. But most important, and really what I think is most important, is the physical injuries that nobody else has identified and nobody really knows how to heal, that your body can't heal by itself and needs extra help for. Well, do you have anything to say in closing, Shauna?
Well, just one small part. You say that the doctors will give you medicine and things like that to make you kind of ignore it. I've not met one chronic pain person that just with traditional treatment is ever pain free. No
That's
amount
true.
that we can give. We increase their Neurontin, we increase their pain medicine to maybe a different type or maybe to a type of patch. And then eventually we get to a point where their bodies still, and they can't handle it, whether it's age or some other change. So really, people can tend to get a little overwhelmed with the idea of, I've got to cut all of this stuff out of my, diet or my lifestyle. But it really is the best shot you've got, and it's in your hands because there's a certain point where the doctors are like, that's it, I give up. There's nothing else I can do. This is just kind of where you're going to have to settle. And don't settle for pain.
And when they get to the point where it's time to settle, usually that next step is surgery to deal with a nerve that we think is causing the pain. And I really want to underscore that. If you think your pain is pudendal neuralgia, if you think your pain is coming from a nerve, as long as these muscles are tender, as long as these attachments to where the bones are tender, there is no way you can convince me that it's coming from a nerve, and you shouldn't be able to convince yourself. Your real answer is to make the things that are tender less tender so you can ignore them also and realize that they create collectively, all these injuries create a pain pattern in your body. And you need to eliminate enough of that so that the collective becomes ignorable. All right. Hal Blatman, Dr. Hal Blatman, based in Cincinnati, Ohio. offices in Manhattan. And I'm here with Shauna Elbiser. Shauna, tell us just a little bit about yourself.
So I've been a nurse for a little over 10 years now. I've worked in specialty surgeries, like transplant at University of Cincinnati Hospital for almost 5 years. Then I came to work with Hal for about 3 years. I went back into acute care medicine because I had learned all of this information. I was like, man, these are the people that need it. So I worked in the float pool for the St. Elizabeth hospitals in Northern Kentucky. And then last fall, I started teaching high school for the Ignite Institute in their pre-nursing college pathway. And I still, I love nursing. I'm meant to be a nurse, and I don't think I can teach nursing without still having my hands in it. So I still work at one of the St. Elizabeth hospitals. I'm on the pulmonology unit in Edgewood, which quickly becomes the rule out COVID unit. So, and anything else that we do a lot of wounds actually. So you get a lot of the folks that have these wounds, either it's a diabetic ulcer or a vascular ulcer, and then all the pain that comes with those, and the amputations and things of that nature. So, yeah, that's where I
That's
spend
awesome.
my time.
Well, thanks very much for joining with us today, and have a wonderful day. And we'll talk next time.
My pleasure. Take care.
Bye now.
You've had concerns about your left knee for quite some time. How long has that been actually bothering you?
Doctor, about 1.5 years ago, my left knee, and I would have difficulty, and I would be concerned whether, literally, if I could walk across the street.
When did you start using a cane? When did you start using a brace?
Actually, the first doctor that I went to was a surgeon, and took the x-rays, and he told me immediately upon looking at the x-rays, you have very bad arthritis, and you need a knee implant. And I just wanted to wait. So I wanted a second opinion, so I went to another surgeon, and that's a second surgeon. He just said, we'll go slow. Started using the brace and a cane, and then I stumbled upon your YouTubes because I had read and watched so many YouTubes about knee surgery, about this and that, about knee. I was delighted and made initially I was very interested to hear your story. Delighted that I made the appointment and came and met you.
You asked me once, what are the odds that this is actually going to be successful?
Right. That's right.
And I said, can you totally straighten, and how far can you bend?
That's right.
And you still had a pretty good preserved range of motion. So
Yes.
then you came in, we showed you what parts of your fascia injuries caused the pain.
Yes.
We helped your body heal from them. Then we used glucosamine preparations to help your body restore cartilage. And then we eventually went to stem cells.
That's right.
And so now this is 2 weeks after that or so.
Yes.
How long has it been since you've used your brace?
I haven't used the brace in about 2 months, and today, sitting here in New York with you in your New York office, this is the first time I have come on the train ride to come to New York without the cane in about 1 year. So today, no brace, no cane, and I'm feeling good.
And no pain.
Yes, that's correct. What you have done, doctor, has been amazing.
Well, good morning, and you guys have had some wonderful stories to tell. We had stem cell injections done about how long ago?
It's been about 1 year.
About
Mine was exactly 1 year, March.
And yours was for pain, and yours was to see what it could do for diabetes, right?
Correct.
And so what's happened with your diabetic numbers in the last year?
Well, about, I'd say 3 weeks after the initial procedure, I always maintain a record of my sugar numbers, and they dropped consistently about 10%, and that has been maintained.
Nice.
I had my 6-month checkup and had a blood test, and my A1C was 6.3, down from 6.6. And then I just had another one 6 months later, which would have been in December, and my A1C was 6.1. And I take no medicine. It's all diet and exercise, plus the stem cell, which I attribute to that reduction, because I was seeing that sugar number, that fasting sugar number, slowly creeping up over the last 4 or 5 years. And that was one of the reasons I wanted to see what the stem cell could do for that. So it's not like it cured my diabetes, but it has ameliorated the symptoms, so that's good.
And so your blood sugars, they used to be around 140 in the morning, is that right?
They were getting up there.
And where are they now?
They're down anywhere from, the other day I had one at 97, which was, that's abnormal. That's a good number for you. That's really good for me. Mm-hmm. And I would say that most of them are in the teens and low 20s, 115 to 125. It varies though. It depends on what I eat. If I'm not watching my diet as well as I should, I can monitor those changes. But I would say, from a management point of view, when I look back at the numbers over the last few years, those numbers are comparable to one of the earlier numbers that I had when I was just diagnosed.
Awesome. And yours was for pain. What's happened with that in the last year?
Right. Well, the first thing, mine was in March when I had it done, and I was due to get my full physical with my doctor in June, and I didn't do anything different. And I had exactly the same tests done for all the blood work and everything. And I hadn't done anything different, and everything was good and down about 10 to 15%. Cholesterol, triglycerids, everything. And everything was normal. That was the first thing I noticed. And then as I went along another month or two, I would notice when I would pick up my twins, my grandson twins, and with my medicines too, I could heal a lot faster.
So when you were too physically active and you hurt yourself, you repaired better.
Yes, I noticed that, and I noticed it more and more, and that's what I just was talking about this morning with you, that I still notice it. That's really helped me a lot. Yes.
Most awesome. Well, thank you very much for sharing this. People need to know what this work can do.
We're very happy that we did it.
Well, good morning, and thanks for speaking a few words for people that are interested in watching and learning about this. You're feeling really good, and there's a few things that we attribute that to. One of them is food changes. Can you talk a little bit about what you've done?
Yes, meeting Dr. Blatman a few years ago, he told me to get a book named Sugar Blues and read it, and I did that. And it really helped me to change my diet, the way I ate. I got away from sugar. When I did that, there was less pain.
And then you had some rotator cuff issues and some shoulder issues, and we used platelet-rich plasma from your blood to help you grow new tendons. And how's that shoulder feeling? How bad was it, and how are you doing now?
After surgery, there was severe pain where I could not sleep. It was hard for me to sit at work, to do anything. So Dr. Blatman told me no more surgery, to get the injection, stem cell.
It was the platelet-rich plasma.
Yes.
Right.
I came, received that, and I'm so grateful today. I'm almost pain-free. With the eating healthy and clean and the stem cell, I am enjoying life now, and I am very, very grateful.
Thank you. I'm here today with Max. We've been working on his knees for several years, and he has some interesting story to tell.
Well, the first time I was back in 2007, I was having severe problems with my knees. The orthopedic surgeons were telling me I had to have them both replaced. I was going to Italy. Dr. Blatman at that time gave me PRP injections, and they made a huge, huge difference. It continued to improve. I didn't have to have my knees replaced. Now, it's lasted for years. Started to have some problems again last year. Well, I recently had Dr. Blatman give me more PRP injections, and I'm exercising again. I'm able to walk. I'm able to walk on a regular treadmill, bearing full weight, and I'm slowly building up. It's terrific. If you've got joint problems, I strongly urge you to at least give Dr. Blatman a call and ask what he can do for you. It sure beats having surgeons cut me open and possibly making mistakes. Things do go wrong. I've seen it happen to other people. This is a far better alternative. Dr. Blatman, he'll take great care of you.
Hi there. Have you been told that your joint is worn out, that your joint pain comes from worn out cartilage, and that your joint is bone on bone and needs to be replaced? Well, if you can totally straighten your knee and you can bend it 90 degrees or more, there is no way through this range of motion that your joint is actually bone on bone. The cartilage is rather thin and rather worn, but if you can still move, you have enough cartilage left to possibly regenerate the cartilage in your joint and save it and not need your joint replaced. Here's an example of a knee that we helped restore, where the cartilage is very worn out and very thin, and a year after stem cell injections, we are able to see that the cartilage has regrown, the vertical dimension and space between these bones has increased. So, it might be possible, just like this case, to save your joint from replacement. Do you have pain in your shoulder? Have you been advised that you have a partially torn tendon? Perhaps a rotator cuff tendon seen to be partially torn on an MRI scan? Before you spend a lot of time in physical therapy preparing for surgery, this short video will show you a different way. If a normal tendon looks like this, then a partially torn tendon might look like a variation of this, or even this. Surgical treatment generally involves cutting the most injured part out of the tendon, cutting back to more healthy tissue, and then pulling the shortened tissue together and stapling it to the humerus bone. You're left with a post-operative pain and a shortened muscle that may require physical therapy to get stretched enough to restore comfort and function. Alternatively, when you stretch a knee, bleeding makes a scab, and 4 weeks later, when the scab falls off, there is new skin underneath. For the past 12 years, I have had considerable experience with taking blood out of a vein in your arm, concentrating the parts of your blood that would make the scab, carefully examining and detecting where your tendons are injured, and then carefully injecting the healing power from your own body into these defects in your tendon. And 4 weeks later, when the scab falls out of your tendon, you will have new tendon parts holding you together. We cannot predict that you will be one and done, but typically we expect to see one and better. How much healing you achieve depends on your age, severity of injury, healing power of your body, nutrition, and the injections being administered into the very best places. If you are considering surgery for an injured tendon, consider helping your body heal a different way, with less pain and less time off work than with conventional surgery. Look us up online or call the Blatman Health and Wellness Center today, 513-956-3200. What does it take to save a joint? A finger joint, a knee joint, an ankle joint, a hip joint, a wrist joint. They all have the same kind of physiology. They've worn out ahead of their time. The other joints in your body are more okay than this one or two. And so now you've been told that your joint is bone on bone. I've already shown you, check out the videos. How do you know how difficult it's going to be to save your knee? How do you know how difficult it's going to be to save your hip? But when you go to do the process, the big deal is, can you balance wear and tear with your biologic ability to restore? There are orthopedic textbooks that say once your cartilage is worn out, you just can't do anything but replace the joint. And I started to wonder many years ago whether that was even possible to be true. I mean, look, you grow new skin,
Every 7 to 10 days, you grow new fingernails, you grow new hair, you grow new brain cells and new heart cells. Does it make any sense that our biology can't repair cartilage from daily wear and tear? So the reason this joint wore out faster than the other ones is you have an injury to that cartilage sometime in your lifetime, maybe multiple injuries. And those injuries have injured the resilience of the cartilage, so it wears out faster in that joint than all the other joints from normal daily wear and tear. So, how can you correct that? Two things need to happen to balance this equation, or there's two places you can reach. One is to wear your cartilage out more slowly, and the other is to grow it more quickly than your body can do on its own. To wear it out more slowly, we teach you to take smaller steps. We teach you to use elevators and escalators. We teach you how to preserve the joint. And then, to grow cartilage more quickly, one of the things that becomes most important is you need to do something every single day that can help you grow cartilage more quickly. And for that, we rely on glucosamine. Well, glucosamine works for knees. Glucosamine by mouth works for knees as long as you have a brand that works. If you've been taking glucosamine for your knees and you have a brand that works and you don't think it's helping, it's not because the glucosamine isn't working, it's because your pain is not coming from your joint. The pain comes from the fascia and the tissue that holds the joint together and helps the joint to move. For your hip, oral glucosamine supplements, I've never seen them work. Not the hyaluronic acid, not anything. The thing that works best to help your body grow cartilage faster for a hip joint is glucosamine through your skin applied with a cream. And we've actually developed a cream that's prescribed in the pharmacy that you can use 3 or 4 times a day on most any joint in the body, and it will help that joint recover. Well, there you have it. That's what you have to do to help balance wear and tear with your body's ability to restore. And then, once you have that balanced, and you've proven that you can make that work, whatever you do at a point in time, you don't have to talk about how long till it wears out, because you're sustainable, possibly for your lifetime. And now we can talk about exosomes, peptides, platelet-rich plasma, and stem cells. I'm Dr. Hal Blatman, Blatman Health and Wellness Center, www.blatmanhealthandwellness.com. Look us up. Maybe we can help you. Have a nice day.